Yes? Okay. Meeting will come to order. Please join me in a moment of silent prayer or reflection. Carrie, will you take roll, please?
Here.
Here. Here. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Do I have a motion to review and accept the agenda for this session?
So moved.
Second.
Do I have a vote?
Yes.
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 Yes. I would like to say at the beginning that we are opening this up for public voice. So if you have something that you would like to say, our address is www.lhusd.org. Or I'm sorry, the email to send your questions or comments to our board meeting at lhusd.org, and we will be monitoring those throughout the meeting. So our first item is item 3.1. It's the discussion and action on new liability coverage from the trust, and this is presented by Dr. Stone.
Madam President, it is recommended that the board discuss and approve the attached Arizona School Risk Retention Trust endorsement in the amount of $75,000.
Do I have a motion on item 3.1?
I move we approve 3.1 as presented.
Second.
Okay. Any discussion or questions?
I have a couple. My concern is, my concern was, and I think I mentioned this yesterday, but now I'm having a hard time finding it because I just saw. Okay, so under conditions 3.1.2, the district makes good faith effort to implement a reopening plan that incorporates applicable guidelines issued by the Arizona Department of Ed for K-12 districts. Oh, that was, I misread that yesterday. Now I remember. And the CDC. The other question was, so essentially, if we operate outside of whatever dictates come down from the state, then we'll be liable?
Yes, I did ask our attorney, and she said we would be required to follow all of the state guidelines.
Okay. So, and then the different plans, I'm not sure what to call them, liability limits.
Oh, mm-hmm.
So we have zero premium. I don't know if I'm saying that properly. If we have the waiver signed, but if we don't have a waiver signed, then it's 10,000. And what's the difference between the acknowledgement and the waiver?
Okay, so we have an acknowledgement form that is the end of our student roadmap, and that's really parents acknowledging that they need to screen their child, and we'll kind of go over that in detail. There are multiple things that they're acknowledging that they're going to do before sending their child to school each day. That is one, and then the waiver is really releasing the district from liability if a student is to contract COVID. Both of these came from the trust, and we sent them to our attorney, who made sure that they were in line with what the district would need, and those are what is being presented this evening.
So when we change the roadmap when the governor or the ADE changes whatever metrics they want to use or go by, then we're going to have to change accordingly in order to maintain this, correct?
Right, we would need to consider those in whatever opening strategies we had.
So if we don't approve this, what are the ramifications? And we were saying that we are willing to be sued, that we are liable and we accept that.
Ultimately, when this first started, the trust came out to say that COVID is an organic pathogen and there is no coverage for organic pathogens that may happen, diseases or things of that nature. They went back to their board and asked that they find a coverage that could be provided to school districts. This is what their board approved as a coverage for what they assume will come down the road, which would be possible lawsuits if people do contract COVID.
Okay. And is this the newly formed board, or is this still the old board?
For the trust?
Oh,
It's
this is
not-
different trust. This isn't.
Correct.
Yeah, you're thinking of
This
the
is-
NAEBT.
This isn't the EBT trust. This is like, is it
The
ASBA
alliance,
trust?
Oh, okay.
the
Thank
trust
you.
alliance.
Thank you.
Sorry.
Thank you.
It's our liability carrier.
Thank you. Okay.
Any further questions or discussion?
It seems like a lot of money for something so obvious. Like, we've never had a waiver for flu, correct?
No.
And we've had a lot of flu circulating around our school district in the last 3 years, and I'm sure that that has made its way to, some grandparents, et cetera, that have suffered from it. I wish I could feel confident that Congress was working on some sort of liability for it, but I don't feel like they can get anything done, so. But it seems like a lot of money for something that I thought the waiver, when we first talked about it, the waiver was to allow kids to come, but it wasn't following all the changing mandates. But now in writing, this waiver would be to follow the mandates that are coming. Well, if you're following the state mandates and we're a government institution, why would there be liability? It looks like a lot of districts are going to make the trust a lot of money and not ultimately have to pay out anyways for COVID related, I don't know.
I think given the sort of novel conditions of all this, you really can't responsibly open schools without having liability coverage. It's different from the flu in the sense that this is new. With the flu, we do have treatment options, we have vaccines, and we just know what to expect and know how to address it. And that's not really true with the coronavirus yet. So,
Well, we don't have a vaccine, but the flu vaccine does not prevent you from getting the flu. I'm not sure what the effective rate is, but it's definitely not a guarantee.
no.
And everybody's looking for a guarantee. And when it comes to treating, we don't really know what the treatments are because the doctors are being shut down by Google, YouTube, Twitter, and Facebook, which is the only platform for getting their information out that are actually treating COVID patients with therapeutics. So,
Well, as you said, there are no guarantees, which is why
Right.
we do need insurance.
well,
Can I ask Mr. Murray, what fund will you take this out of?
Well, currently it'd be maintenance and operations. However, we are looking to see if we can use other funds, especially grant funds that have come available
Okay.
recently, to see if that would be a qualifying expense.
Sorry. Let my pen catch up. Okay, any other further questions or discussion?
Is this going to be annual?
Yes, it is, that is an annual coverage.
Well, when this virus has passed, then that will be the end of this expense, right?
It should be, and hopefully, as Mrs. Cohen pointed out, hopefully there'll be some acting of legislation in the future, whether it's at the state or federal level, that'll allow maybe some protections to be put in place, as long as we're following certain guidelines. But right now, that just has not come to pass at the moment, so we are needing to protect ourselves. At least that's the recommendation.
Anything further?
So we're not going to treat a parent differently. I mean, there would be no difference if they just sign an acknowledgement or they sign the waiver.
No difference from us.
Correct. Like when we begin to open schools, if parents don't sign a waiver, then we're just going to eat the $10,000 if there's an issue.
And what they have shared at this point is that you are sharing that with your entire school community. You are hoping to get as many back as possible, and that you've taken the good faith effort to try and get it back from everyone.
So when the time comes where we discuss opening our schools, are we going to do it with the caveat that you have to sign the waiver? Or are we going to allow students back on campus whose parents only signed the acknowledgement?
I think that's a discussion that we can have, but there's nothing that says if you don't, you may not come back on campus. We do have other options, so if people are uncomfortable with that, they could choose the other options, but again, that's a discussion to have.
Just if I was a parent, I wouldn't sign a waiver if I could simply sign an acknowledgement. That's all.
I completely understand, and we are going to have both of those sent home
Okay.
for folks to sign.
Okay.
Anything else?
Nicole Cohen,
Yes.
Kathy Cox,
Yes?
Archana Alliar,
Yes.
Lisa Lamont,
Yes. Item 3.2 is the discussion and action on parent waivers. And this is presented also by Dr. Stone.
So, Madam President, it is recommended that the board discuss and approve the attached parent COVID-19 waiver release and assumption of risk form. This was approved by legal.
Do I have a motion on item 3.2?
I move that we approve 3.2 as written. I second.
Discussion or questions?
It's an awfully long list.
I think the purpose of this is to establish parents as the gatekeepers for their children. We want our families to be the first line of defense against community spread, and so that does mean carefully monitoring your children for signs of illness and being willing to keep them home if they show symptoms. We ask that you don't mask their symptoms, don't give them Tylenol or something if they have a fever, and send them to school. And we are asking you to sign this as an agreement, as you know, our school is doing, when the time comes to reopen, our school wants to do what it needs to provide education for your students, and we are asking that you do your part as families to keep our staff and our other students and our community safe.
Also, I believe I read, I'm looking for it now, that if a parent finds out that the child has these symptoms, and of course the key one is the fever of 100.4, that the parent will keep the child home and let the school know. Am I correct? Is that in there?
Yes, it does say that I will notify the school and not permit my child to attend.
Because that's a really important part for us to know which students that child was in contact with and let those parents know and act upon that.
Any other discussion or questions? Are you ready to vote? Okay.
Kathy Cox,
Yes?
Jenna Alliar,
Yes.
Nicole Cohen,
Yes.
Lisa Roman,
Yes. Item 3.3 is the discussion and action on updated roadmaps presented by Dr. Stone.
Madam President, members of the board, it is recommended that the board discuss and approve the updated LHUSD roadmaps. Updated roadmaps were shared electronically prior to the meeting. We will go over them here for a moment, and I'm going to start with the employee roadmap to reopening, just to discuss the changes. On page 4, we have included the safely returning to in-person instruction kind of decision tree by Arizona Department of Health Services, just so everyone is aware of those benchmarks and what they are using to provide guidance for us. On page 6, for communication, the district is asking that all employees screen themselves daily for symptoms outlined in the roadmap, and it is the expectation that they will not report to school or work if they're exhibiting symptoms. And we would require, as part of the employee orientation training, a documented acknowledgement from employees regarding the protocols and agreeing to screen themselves before reporting to work. The other piece that we added, as you saw in the waiver and some of the other things at the bottom of this page, are additional symptoms. It does note that this list may not include all possible symptoms as we learn new things as we go through this. On page 7 is where we start with face coverings. Currently, the Governor's Executive Order 2020-51 requires that all students and staff wear face coverings at all times, with exceptions when students and staff can maintain proper physical distancing of 6 feet or are outside in playground settings with distancing. And this is in effect until the Arizona Department of Health Services determines face coverings are no longer necessary.
So was there any discussion about that with the county for our littlest students?
So today we did talk to the County Health Department liaison, and unfortunately they couldn't be with us here today. They are recommending, even for elementary students, anyone above five years of age and above, unless they have some sort of documented respiratory situation that would not allow them to wear the mask. I did ask for peer-reviewed studies and things that they are using, and they were going to forward those to me. They were hoping today, but that has not happened yet. So as soon as they do, I will provide that to the board.
Just as a point of order, I don't think we've made a motion yet, just for questions. All right. We can go ahead and, we didn't take a motion, right? Am I?
didn't.
No.
Yeah.
Okay.
Up to you.
So I'll review the rest and then we can make the motion.
Okay.
On page 8, we just took out, field trips will be suspended. We took out for the first semester because we really don't know what this is going to look like. So it just says for now they're suspended, and we can make changes as needed. And the final piece, and I'm going to ask Mrs. Walter just to explain for a minute. There have been a lot of questions on what is our procedure when someone has COVID-19 symptoms or has a positive test. This was previously in the roadmap, but I'd like her to review it just for a minute so that the public knows what's in here. And it also includes a flow chart that was created by our personnel department.
So depending on the situation of the parent or the student, staff members, obviously we're talking staff right now, we're at school. A different life. One semester. If an individual is sick on site we will obviously take actions to isolate. The school nurse will be working with the individual involved. At that time, they'll be using the guidance for being able to make sure that there's personal protective equipment in place. And again, if there is a need for emergency response, they would respond accordingly. At that time, we do have a survey. The nurse would be conducting that survey as appropriate to find out the information, to find out who may have been exposed, and helping them to determine what notifications may be needed moving forward. So we do have our staff needing to complete that. And again, the nurses will conduct that interview with the parents for students that are calling or reporting, or for those incidents on site. If it happens at school, they'll take measures to isolate the area and clean and disinfect. They're able to leave the area unattended for a period of time. They will try to do that. If they need to close off the area for 24 hours to allow for deep cleaning, depending on the situation. Those are procedures that will be in place to mitigate. We do have the survey, as I had mentioned. Staff will be completing that. The notification goes out to principals to have that information to be able to determine when the contact may have happened as to the notification. We do have in place procedures for written notifications and phone contacts. We have a very extensive flowchart that Ms. Today created, because there are a variety of situations involved. If they tested positive, depending upon when they took the test and how long it's been involved, steps will be taken. Staff will be asked to self-quarantine for that completion. And again, depending on whether they're the 10 days based on when symptoms started. If no symptoms, again, exposure is that 14-day quarantine. And again, we'll consult the CDC guidance because it changes, as you well know, and making sure that our staff at that time notifications will be based on the most current guidance from the CDC and working through that. And also through the Department of Health, because they're going to be working closely with us in guidance as we go through. We do have to notify the Department of Health if we have confirmation. Again, they'll work with our staff to go through that contact tracing and helping to determine the situation. Because again, determination of when it may be necessary to do those intermittent closures, we'll be working closely with the county health department to make those decisions.
One of the things that does get a little confusing when people do read the flow chart is that if you have tested positive, your isolation period is 10 days. But if you've had close contact with that person, your isolation period is 14 days. And that has been explained to us is that your symptoms may appear anytime between 2 and the 14 days, which is why they ask you to isolate longer than a person who has already tested positive. Okay, those are all of the changes to the employee handbook, and I'll go over really quickly the changes to the student handbook and then can make a motion or discuss. So for the student handbook, again, we use the chart for safely returning to in-person instruction from the Arizona Department of Health Services, which is the decision tree with the benchmarks. We also gave some information about communication, and that is that piece, page 7, which talks about the acknowledgement form, which is at the end of this document, and that we'll be asking parents to sign, which is agreeing to screen their children daily before sending them to school, and also talking about the protocols we're asking them to follow. On the same page, again, that addition of symptoms, as that list changes, we would add or remove if necessary. On the next page, that starts our kind of conversation about face coverings. This is on the school bus. They would be required to wear face coverings. In the event that our ridership is such that kids can be physically distanced and spaced out in seats, they would be able to take them off. On page 8, we talk about enhanced physical distancing, and that is really just about the fact that we would educate and remind students regularly about social distancing to the extent possible, both inside our classroom when we have them there and outside of the classroom when they're in the hallways, when they're in cafeterias. We will do our best. We should strive to maintain a distance of 6 feet from others. We all know that if all of our students were in schools, that would be absolutely impossible. So this is why it says we're going to strive to maintain that 6 feet, but really do our best to maintain at least an arm's length from others. On page 9, we talk about our signage directing visitors to wear a face covering. So you've seen those, if you've been to the schools recently, you've seen those at the front. There is a section, our next section is about cloth face coverings. And again, that says the same that you saw in the employee handbook, that we're required, all students and staff are required to wear face coverings at all times. And that is in effect until the Arizona Department of Health Services determines face coverings are no longer necessary. I took out the small piece about field trips will be suspended for the first semester because we're just not sure at this point. On page 12, it talks about our visitors and volunteers. Although those will be limited to non-essential, we're limiting all non-essential visitors and volunteers at this time. They would still be required to wear a face covering. Potential school closures is another area that has been added. This is the Arizona Health Department benchmarks regarding the level of community spread. They were released on August 6th for consideration when opening or closing schools. The benchmarks include the number of cases, the percent positivity, and the percent of hospital visits for COVID-like illness. The ADHS recommends county-specific public health benchmarks fall within the moderate or minimal spread categories in all 3 benchmarks for 2 weeks in order to provide hybrid learning with some students in physical buildings. Specifically, ADHS recommends the following benchmarks be met prior to offering any in-person learning. So for cases, it's a 2-week decline in the number of cases or 2 weeks with new case rates below 100 per 1,000. The percent positivity is 2 weeks with less than 7% positivity. And the COVID-like illness is 2 weeks with hospital visits due to COVID-like illness below 10%. In addition, if schools are open and are then ordered to close by the state, we would implement our distance learning plan. We did include the flow chart at the end of notification for students, the same kind of when they would be isolating at this point. And then the final 2 pages are that parent acknowledgement that was approved by legal. And it's parents initialing each of the, let's see the number, each of the 11 acknowledgements they have. And it does seem long, but it's really explaining, I understand that I will not be permitted to enter the facility or school beyond designated drop-off and pickup areas. This is for the safety of all persons present. I understand it's my responsibility to inform other members of my household of this information. I understand that if there is an emergency requiring me to enter the facility beyond the designated drop-off and pickup area, I must wash my hands and wear a mask before entering. While in the facility, I will practice social distancing and remain 6 feet from all other people except my own child. I understand that in order to attend school, my child must be free from COVID-19 symptoms. If during the day any of the following symptoms appear, my child will be separated from the rest of the class and moved to a supervised, secure area. I will be contacted and my child must be picked up within 1 hour of being notified. It lists the symptoms that we're asking them to look for. While the district understands that many of these symptoms can also be due to non-COVID-19 related issues, we must proceed with an abundance of caution during this public health emergency. Symptoms typically appear 2 to 7 days after being infected, so your child will need to follow the most recent guidelines for isolation, which will be provided to you by the school nurse. I understand that as the parent or guardian, I will need to take my child's temperature prior to coming to school. I understand that as the parent or guardian, I must also conduct daily self-screening of my child for symptoms prior to the child arriving at school. I understand that over the course of the school day, my child's temperature will be taken if necessary. I understand that my child will be required to wash their hands throughout the day using CDC recommended hand washing procedures. I understand that my child must wear a face covering throughout the day according to the protocols established by the district. I will immediately notify the site point of contact if I become aware that my child has had close contact with any individual who has been diagnosed with COVID-19. The CDC defines close contact as being within 6 feet of an infected person for at least 15 minutes, starting from 2 days before illness onset or for asymptomatic patients 2 days prior to specimen collection, until the time the patient is isolated. The site or district will continue to follow the guidelines of both the CDC and state and local officials. As changes occur, parents and guardians will be notified. The site point of contact will contact the Arizona Department of Health Services if any staff member or student contracts COVID-19 to help make crucial decisions on next steps. I understand that while present at school each day, my child will be in contact with children and employees who are also at risk of community exposure. I understand that no list of restrictions, guidelines, or practices will remove the risk of exposure to COVID-19. I understand that the members of my family play a crucial role in keeping everyone at school safe and reducing the risk of exposure by following the practices outlined herein. That's the acknowledgement that we are asking them to send. So that is both the employee roadmap and the student roadmap.
Do I have a motion on item 3.3?
I move to approve 3.3 as presented.
I second.
Okay. Discussion or questions?
I have a question as to what happens if students or employees or someone has COVID and will we have to shut down the school and will we have to restart, and what is our expectation and plan for that? In detail, because I couldn't follow it from whatever I've read so far.
In detail is a great question. So it is really part of our the next conversation that we're going to have, and that is all the information that the health department has provided us at this time. But it's really using that safely returning to in-person instruction. And as they have shared with us, there are the 3 benchmarks, and we'll look at those in detail on the next item. Those 3 benchmarks are currently, if you saw them in the paper, 2 are green and 1 is red. Anytime that 1 is red, they are going to recommend that you go back to distance learning. So that's really what we're looking at right now, is deciding really on the next item, or if we're following all the health benchmarks and how that will look in each of our schools for the entire district.
So we'll come to that soon.
But these are the benchmarks that we would approve. If we approve this, then these are the benchmarks we would use starting with this new on-site opportunity that parents will have who have special needs to get in their children to school. And then it's the same benchmarks that if we do open up in school, that it'll just be the same.
Yes.
Any further discussion or questions?
So this is such a cluster, and it's going to continue to be a cluster. These metrics are not, we will never be able to meet them. So every parent out there who's looking for answers, and every teacher, many of whom emailed me today, I think there was an email Nicole Cohen campaign today with the staff. There are no answers because we're not following the actual science. And the idea that this benchmark to open, for example, sorry, I just had the page, the checklist, cases, we should really have a whole conversation on what's determined to be a case, because a PCR test is not a case. So it has to be in a 2-week decline, but at the same time, this state is going to be chronically and constantly pumping tests out there. Everybody needs to get tested, healthy people or not. And this PCR test is picking up fragments when you don't even have the virus. Because while COVID-19 may be novel, COVID is not. And so people who are, from what I'm reading, and it's very unfortunate that the health department is not on the line to answer these questions, or that we don't have medical representatives here to answer these questions, because I know that there's people who will not listen to anything that I have to say, but these PCR tests are outrageous to use as part of the benchmark. So we're not going to hit that percent positivity number. And then the idea that our hospitals need to stay below 10% with COVID-like illness, well, that's the flu. So here we are heading into flu season, and it's just not going to be attainable. So the reason I say this is I can't support this, and I understand how frustrated the parents are, and but your government school is going to control your life, period, end of story. It is going to be a never-ending, constant changing. You will not be able to count on anything if you are wanting your children to be educated through our school. And I can't in good conscience not make that known to anybody who's watching. This is so absolutely ridiculous, I can't even speak about it anymore. It's definitely my recommendation that you homeschool your kids. I never thought those words would come out of my mouth, but the idea that you would subject a 5-year-old to a mask is so outrageous to me. It's outrageous. So.
Just as a couple points, I received many staff emails too. I don't think that they were picking on you.
I wasn't saying they were picking. I didn't mean to sound
Okay.
thin-skinned about it.
Okay, I'm just saying I've heard from a lot of staff members as well.
Yeah.
As far as the continuity of education, that is why we put into place our distance learning program and the PLP Online Academy. We don't want to have start and stops with our kids' education. That is the exact scenario that we're trying to avoid. And so, you know, I heard this saying, but school buildings may be closed, but schooling itself will continue. And that is the goal. That is what our district and our teachers are working so hard to do, is to provide that education progress for our children. You know, we are in the midst of a public health emergency, and so things are not normal right now. And that's just the way it has to be for the time being.
So
There are a lot of other go ahead.
No, it's not normal, but why isn't it normal? I mean,
Because we're in the middle of a public health emergency.
but says who? Says what data? I mean, we've had 15 children under the age of 18 die since this started. 15. We've had thousands die from other reasons. So the idea that we're having this conversation while life still goes on in our town says to me that, you know, there should be some evidence to support what we're doing. There should be definitely a clear expectation for the numbers that we're looking at, and this initial reopening checklist is outrageous for that, especially if we're not just testing people who are symptomatic, we are pushing tests on everybody. And if all you have to do is DuckDuckGo or Google, in most people's cases, COVID-19 tests, it's outrageous how many tests out there are. Everything has been pushed through so quickly, and then those numbers are going to determine whether or not we're meeting that metric, or percent positivity, or the hospitals being below 10%. I mean, I was just reading that 42 hospital systems have filed for bankruptcy during this time. And healthcare is 35% of our GDP in this country, and 80% of what takes place in those hospitals are elective surgeries. So just like our schools, the hospitals have been open and then closed, depending on the hot spots. Nobody is having a conversation beyond the cases, the percent positivity, and the COVID-like illness. We're not having discussions about all the other numbers and all the other deaths that are taking place. And while I'm not out and about all that much, it's not because I'm afraid to be out and about, it's because I'm a homebody. But when I do go out, I'm seeing the same people at the grocery store, I'm seeing the same people at Shogun, I'm seeing the same people going about their life, and everybody is trying to go about their life, and the one obstacle in our community is our school district, because we're listening to the experts who won't provide us any peer-reviewed studies that they're using to make these decisions. And I just think that parents who are having a difficult time, like the woman that you just saw walk out as we were walking in, I've never met her before. She was distraught. She was very distraught. And I feel for those parents because they can't make a decision with this. And that's why I say that. And as for the trying to provide some continuity, it's outrageous. I mean, I just heard from that parent, her first grader is in tears all the time, so there's no continuity there. And she has a high schooler who just had their Google account hacked and exposed to porn. So what are we doing? How are we going to fix all this? We can't fix all this. This is all designed to create the chaos we have. And I can't support any piece of it other than the two things I just voted for. Those are housekeeping. But this plan, there's no plan that is going to satisfy every staff member. There's no plan that's going to satisfy every parent. But the idea that you're going to leave your family open to the constant disruption of our changing plan seems not worth it. It just doesn't seem worth it. It's easy for the people that are in this room because there's maybe a little more security in everybody's lives in this room. But this is the exception. This is not the rule in our community. And for people to, I mean, how many hours a week are our students in first grade having in front of their teacher? This is a question for anybody that can answer it. First grade student, how many hours do they have FaceTime with their teacher online?
So students have 2 live sessions every single week.
How long are those? 30 minutes?
And then they have office hours every single day that are an hour.
So a first grader is getting 1 hour.
That doesn't mean that there isn't video instruction.
That's not teaching. We've got YouTube and there's a ton of video instruction out there. I'm just saying, that is not having a
Well, YouTube doesn't give feedback.
But they could, if they had a question about a video that they saw on YouTube, they could go presumably to the office hours or during the live learning session.
So if you watch a teacher do a video and then you do an assignment, the teacher then gives you feedback. So if
Gotcha.
watching something is very different than watching the teacher do and I do, like this is how we do something. Then I practice and then I get feedback from my teacher.
I see what you're saying.
Right. So, but we're still talking 1 hour a week of face-to-face
And so
for first graders. For live, 2 30-minute days.
Plus additional time if they choose to log into the office hours.
I'm talking about face-to-face with the student. The office hours are not for first grade students, they're for first grade students' parents. Because first graders aren't, they have to have a parent there. First graders aren't home alone. There has to be a parent there to do all
Okay, but it's still
this.
for them, they are still interacting with their teachers, presumably, if they're engaging in those office hours.
Okay, I understand that. So how many hours then a week? I'm sorry. So we have 1 hour of live, 2 30-minute, and then office hours.
Which is for an hour each day, except on Thursdays or including
Correct.
Thursdays?
correct.
So each student gets an hour each day of one-on-one time with their teacher?
If they chose to log into office hours, it's not mandatory.
But they can,
They
so
could,
that's,
Absolutely.
It's available to them. Whether or not they choose to take advantage of that.
so 5 hours a week.
But then,
But our students used to be in school 6 hours a day. And now it's 5 hours a week. there's no continuity. There's no way to make it, there's no way to do this.
It is different, I'll grant you that. It is an adaptation that we have to make because we are in a public health emergency.
So I would really love to see a video in here of what a teacher is doing. I'd like to see an example. First, kindergarten would be fine, first grade would be fine, or something else. Because you've got the classroom teacher, and I assume the classroom teacher at that age is teaching reading and math. And what else?
So there are 9 video lessons that an elementary teacher posts every single week. 3 for math, 3 for ELA, which would be language, and then 3 for reading.
And the videos are of the teacher.
There would be the direct instruction.
So the child can go back to the video if they didn't understand and watch it again. But it's of the teacher. It's not like National Geographic or something
It's
like
of
that.
the teacher.
But the teacher has FaceTime with her class twice a week.
Correct.
But the rest is on video. And then there are people like your art teacher, your music teacher, and your PE teacher fit in somewhere.
Correct.
And now we've got elementary counselors who are going to try to present a program to the students. Is that about all that elementary will get?
Correct. So they would get all of their specials throughout an entire day.
Okay.
So, for example, so in a first grade classroom, they would have, this is their math lesson of the day, which would be a video of their teacher, their practice. Most of the elementary students, they have manipulatives that are going home and writing practice. They have little packets that are being sent to them, and then they are being picked up as well. And then in addition to that, with the elementary, there is typically like the different computer software that they use. So the Discovery Phonics, so the things that they would typically use in their computer lab.
Well, I can tell you right now that classroom teachers are spending a lot more time creating these lessons than they ever would if they were working in their classrooms every day. They can't just walk in and use the knowledge and experience because they have to put the material together. I can't imagine videotaping myself and being in the right spot and walking out of the camera. I mean, I know I would. I'd have to redo it again. I mean, but I mean, they're learning. You know, they're getting it down. So it's a lot more involved. But I've actually heard some really good things about the instruction because teachers really have to think this out. They have such limited time, and they have to condense things and make sure that it's pure and to the point and that kind of thing. And they're learning as they go. I mean, it's not perfect yet, and it never will be. But I mean, I understand Nicole's issue and her concern about that. But I know the teachers have been really busy. And then as you get into higher grades, you might have a separate teacher who's the science teacher, or a separate teacher who's the math teacher. The student may be assigned to his reading teacher, but but that's the main teacher. We call that the classroom teacher. But there are other teachers that student comes into contact, especially in the higher grades, even at the elementary level. At some schools, each school is different with that. So I don't know. It's certainly not. It's certainly not perfect, but you know, right now it is what it is.
I just don't think that we're giving any, at least discussion time. Maybe people are thinking about it, but they're not discussing. I don't really care if it's difficult for the teachers. The teachers are being paid to do this. And I hate to sound like that, but...
Well, they're not complaining about it. I just know it's a big
Well, I got
change.
quite a few emails today that, you know, they seem like complaining emails to me. I'm not going to say any names, but, you know, I definitely was, you know, schooled about how difficult it is. But is there any thought about how difficult it is for the parent?
Well, yes, absolutely.
Because we don't really discuss that. And what kind of position are we putting all the parents in that now have to make the choice to work or to stay home and educate their kids? Because while we're discussing how difficult it is for the teacher, there's a parent that has to be home for these little kids. I mean, we've turned their lives upside down.
correct me if I'm wrong, but I thought when we surveyed the parents recently, that the parents who need childcare have the option of bringing their child back into school. And so far, we have 576 parents who have asked for that option, and those parents are going to be granted that? Is there?
Do you think all 576 of those parents are happy that they have to make the choice to bring their child to socially distance, to wear a mask, and to conform to all these ridiculous mandates for little students?
I think happiness is not the key here. None of us are happy to be doing this. This is not my idea of a good time either. I would much rather have in person. I would love to be able to open our schools, but we have to wait until it can be done safely.
It's never going to be done safely. It's never going to be able to be done safely.
We have benchmarks that let us know when it will be safe to reopen again.
We have nurses that are in full gear in their PPE at our hospital who have contracted COVID while on the job, fully protected, because they don't work. Because you can't be 100% safe. And it was never supposed to be that. It was flatten the curve. Now it's one child is too many. We've made a huge leap here without question. Nobody's even questioning it. And all I'm saying is we're having these conversations that it's a false choice, in my opinion. The idea that you would send somebody for their first grade in a public school to wear masks. You know what this is going to turn into when we open our schools with the mask? It's going to be turning into complaining about the mask. Little Johnny had his mask off and such, isn't wearing it right. And little Audrey keeps picking her nose and rubbing it on her mat. I mean, it's going to be a ridiculous amount of chaos around this. Instead of the school, all the staff, all the parents unifying, looking at the science that's available, demanding it from the county, from the governor. Dr. Chris sat up there at the last board meeting and said, we know that the science says that, children under 10 don't spread the disease, but we want them to wear a mask starting at 5. That's control. That's conditioning.
Now, wait a minute.
That's unacceptable.
Okay, about a week ago, I heard that children, especially younger children under the age of 10, don't get it. And they don't, they might have the virus in their noses, but they don't spread it.
I never heard that they didn't get it. We had this conversation before because Archie challenged me on that. They don't spread it.
They don't.
That's what Dr. Chris said.
Well, but come this week, and you saw what Georgia did. They put all of the kids back in school. Now, in one district, 900 of their students are testing positive for the virus. That one high school where the kids were in the hallway, 6 students and 3 of the staff members actually have the virus now. That is just total chaos, and I cannot vote to
out of 900. How many did you just say?
I said in one school district, 900 have tested positive now that Georgia opened up like that.
But testing positive doesn't necessarily mean that you have the virus. That was the point I was making about the PCR test.
Well, and I understand that's the whole.
But these conversations aren't happening. They're not happening at county level or at a state level or with the CDC. It's just this constant propaganda about we need more testing and oh my gosh, look how many people have it. But we're seeing the world go on. And when you hear that from the beginning of this, 15 students have lost their lives due to COVID in our country, not our community, in our country, I mean, we should be questioning. So in my opinion, we should be questioning, and we should be asking for very specific information from the county and the state on what we're using so we can all begin to understand why we're doing all this.
Well,
it just seems wrong that we're not.
Let me go back just a little bit. The problem with the tests is exactly what you said. You can test positive, and apparently a day or 2 later you can test negative. You can test positive, and then you can come down actually with an illness. You can test positive, and you don't even know that you're a carrier. You don't know anything. That's not science. So my thought when you don't have any real science to rely on, is we have to be so conservative about what we do to keep ourselves safe. And I'm just as concerned about our kids and our staff. I'm also concerned about our town and our community. We've closed down, and we've opened up. Now we're closed down, now we're opening back up again.
And we'll close down again.
Well, the reason we're going to have Labor Day is coming up. And when that happens, it's going to go back up. And
Can
so,
I ask a question? I'm sorry to interrupt, but I would like to know whether the distance learning program that we just spoke about, the 1 hour interaction, etc., how much it is, how similar it is to the PLP or homeschooling programs, and is it better, worse? Have we tried to make it like that? Will it be about as convenient or inconvenient for the parents? Could I please know the answer to that? Because I don't think we are going to solve the world's problems sitting here in our little school board. So I don't really feel like spending all the time doing this. If we want to come back to that discussion, I would like to ask Mrs. Rahman if we can do that after the school board meeting, so that right now we can make some decisions based on what we have available. We are the country with 25% of the world's cases and with 5% of the world's population, just for everyone's information.
Has anybody,
Actually, the chair recognizes Dr. Stone.
oh, sorry.
It's okay. Just for this, so this is for actually the student and the employee roadmaps. And then the next question that we're really discussing are these benchmarks and PLP and distance learning. So I don't know if you want me to mix those two or you want to.
Well, I don't have a
Stop here.
copy of that roadmap. I mean,
These that we emailed yesterday, the student.
I know, but I don't have all I have is this, so I don't have a copy of that to go through, so. Well, I don't want to write on your copy.
But you can have it.
Okay, I would love to have a copy, because I don't have a hard copy.
We weren't given hard copies for some reason.
So it just seems,
I printed out from my computer.
Oh, I read it, but I thought we were going to get it.
thank
so I
you so
didn't
much,
bring it.
I
Abby.
got this.
Would you like
this
it?
here?
Yes, I've got it.
Would you like?
No, I'm good, I remember what I.
I can go back to the roadmap on the screen if you guys can go back.
I think that would be helpful.
Yeah.
Thank you. I'm sorry? Yes, please. I think that's the one that's most sort of pertinent.
So again, the basic changes in the roadmap are the acknowledgement at the end, the placement of face masks in different areas in the roadmap that include for students, for visitors, for volunteers. The adding of symptoms as that list changes.
So when a student has allergies and is chronically sneezing, is somebody going to be overly cautious and isolate that student because they're sneezing? Because,
The key is the temperature, 100.4.
but for students, diarrhea is really the issue for small students. Anyway, that's what I have read. They don't even present, many of them, with the temperature.
So under the symptoms, it does say this list may not include all possible symptoms, but a student with a daily runny nose or congestion due to allergy should not be kept at home. So we do want parents to notify us if their student has a medical condition that causes some of these symptoms. It wouldn't be appropriate for them to stay at home.
And then if a student did come down, and I just want to clarify this, not that it's not in here, it may be.
Sure.
So, but if a student is sick and is isolated and is sent home, and is anybody at our district going to be reporting to the county or to the state? Any names for contact tracing?
What they shared with us yesterday from the county health department is the only thing that they were asking for were classrooms or buses to determine if they get a group of students who are all testing positive, because they will get that information as a student tests positive. that they were looking to see, do we have one classroom affected, or is it multiple classrooms, or one bus affected, or is it multiple buses? They did not say that they would be requesting names.
But they'll know the names.
If the parents have them tested.
Well, yeah.
Yes.
But then that's at their own discretion. Yeah.
Right.
So the roadmaps, approving this item gives us a way to basically keep our student handbook updated with the relevant information without bringing back our handbook for review every time, the handbook in its entirety for review every time we want to make a change. Is that a correct summation? Okay.
And there's one for employees and one for students and parents.
And I say that mostly for the benefit of people watching, that, you know, if we vote to approve this item, that doesn't close the discussion on reopening options. That is our next item.
And I do want to share, there was a question about if the waiver was also for employees. Employees are actually covered under workman's comp, so they do not have a waiver to sign.
So is there any more discussion just on this roadmap?
You're still going to answer me later about it.
Okay, then I think we're ready to vote.
Archana Alliar,
Yes.
Nicole Cohen,
No.
Kathy Cox,
Yes.
Lisa Roman,
Yes. Item 3.4 is the discussion and action on LHUSD reopening options. And the way I would like this to go, I know, or I suspect, that there are quite a few emails from our public. We do want to hear public feedback. So I would like this to go with Dr. Stone making her presentation. I would like to hear the emails, and then I would like our board to discuss. Does that sound like a reasonable strategy?
How many emails are we talking about? Over 50? Are these from parents or staff?
I think we have all received a lot as well. Yes. Of emails. And so if you can, maybe if Dr. Stone could spell out what we're looking for.
Yes.
And then we can talk again.
That's what I would like, yes.
And are all of the emails about an agenda item rather than something else? Because we can't discuss anything that's not on the agenda. That can come later, call to the public. There's no call to the public on this agenda.
Sounds good.
Pretty sure they're going to.
And then the other thing that I have asked for is the following meeting is that we will only read for 5 minutes. So if you're going to put a comment in, submit a comment, then put your point of what you want to say at the very beginning, because after 5 minutes, we stop and go on to another comment. But, I mean, we'll have to discuss that, but that's what I have asked for.
For now, can we go with Dr. Stone's presentation?
So, Madam President, it is recommended that the board discuss reopening options and select a plan for LHUSD. And I'm going to provide you with a lot of information and then really talk about where do we go from here. One of the things, I first wanted to share the fact that we have received a variety of information from the Arizona Health Department as well as the Mojave County Health Department. What you see on the screen right now are the COVID-19 school benchmarks by Arizona County. So this is what was published in the paper, and this is what will be published weekly from the Arizona Department of Health. And currently, Mojave County meets the benchmark for a number of cases, which is a 2-week decline in the number of cases. They meet the benchmark for COVID-like illness, which is 2 weeks with hospital visits due to COVID-like illness below 10%. What we don't meet currently is the percent positivity, and for initial opening, they have recommended 2 weeks of percent positivity, less than 7% within the county. The next piece is the presentation the Arizona Department of Health provided, and you can get this on their website. It's the Safely Returning to In-Person Instruction. We're just going to kind of review the first 10 pages. It's an introduction that just shares really that aside from a student's home, no other setting has more influence than your schools. And they understand that everyone, I think everyone in this room, and certainly most of our teachers and staff, all believe that having kids in school is important. And they all do want to have that time with their students. However, there is a significant amount of concern around the current health situation and benchmarks. So this is where the Arizona Health Department has kind of landed with what they believe are the benchmarks to look at in order for us to be safe in returning. And they're all based around the community spread. So when there's minimal community spread, you would be in the green column. When there is moderate community spread, you would be in the yellow column. And when there is substantial community spread, you would be in the red column. As I mentioned before, any indicator that is in the red would indicate that we should not open to in-person learning, but continue with distance learning, or if we happen to be in person, to go back to distance learning. This is a little more clarity around understanding the benchmarks. And it just breaks down each one of them, cases, the percent positivity, and the COVID-like illness. This is additional considerations for offering in-person instruction. They recommend county-specific public health benchmarks fall within the moderate or minimal spread category in all three benchmarks. This talks about before offering any in-person learning for the first time. Cases would be below 100 per 100,000. The percent positivity would be 2 weeks with less than 7% positivity. And the COVID-like illness would be 2 weeks of hospital visits due to COVID-like illness below 10%. It says local health departments may modify a specific benchmark. At this time, they have not modified anything. The next piece is community spread levels and schools. This shares things that would be in place based on the level. So if we were in the red, all of those are considered not applicable because they would recommend that we not have students on campus. If it is in the yellow or moderate column, the things they have recommended at the top are hand hygiene and respiratory etiquette, enhanced cleaning, proper ventilation, monitoring absenteeism, symptom screening, physical distancing of 6 feet, cloth face coverings, cohorting of students, field trips and large gatherings canceled, and communal spaces closed. If we were all in the green, you can see the list of things that they are recommending goes down significantly. The next one is the same information. It's just using the benchmarks to inform reopening and what that would look like. The next one is using the data dashboard. So this is when they will report information. So when you're going to their website to find information, while the dashboard update is on the date that is on the left side of the page, it's actually referring to the date and time period that is on the right side of the page.
I would like to point something about that out. Apparently, the statistics that come out that are produced every week, I believe, the ones that just came out this week don't take into account last week. They're only about the previous 2 weeks. So it's like we don't really truly know at any given point in time in the present what the real statistics are,
Right, they are not reporting current week statistics.
or the previous week, it's the previous two,
It's the, I believe it's the previous 2-week period, yes.
but not last week, right? So,
There is some lag because
Yeah.
it takes them a while to compile and make sure that, confirm the accuracy and before they report numbers.
which makes it so difficult for us to make a good decision.
So then the next page just shares the dashboard and what it looks like when you are looking on their website. And this piece talks about responding to COVID-19 in schools, and it talks about the symptoms that they're looking for, what to do when someone on site has COVID-19 symptoms, and that is part of our the roadmaps that we just reviewed. What to do that continues, and then quarantining classes or closing school buildings. So they give a little bit of information on there, but really that's a conversation with your health department officials or liaisons when something like that does happen. The remainder of the PowerPoint is really supplemental materials for schools to use, such as how to wear a mask, how to wash your hands, symptoms, physical distancing, the continuum of school learning scenarios, cloth face masks, and then the final page is really that safely returning to in-person instruction piece that is in each roadmap, so everyone can see that if needed. So that's the first piece that we received from Arizona Health Department. The first and second piece, actually. So it was the benchmarks. Where we are now, we have 2 greens and 1 red. That is the PowerPoint they presented. Some other information that I just wanted to share as we kind of go through this process. We did survey our families who are in need of on-site support. Currently, as Mrs. Cox mentioned, we do have 576 students who are signed up for that on-site support. They range from 33 at one school to 83 at our highest schools, but all schools do have students who are requesting that support. That is just another piece of information that I wanted to share. We also have, a question was asked about PLP in terms of how many students do we have registered for that. Currently, 251 students are participating in the PLP program.
do you know why parents selected that rather than the distance learning with the classroom teacher? Do you know why? Any idea?
I think there's a range of reasons. Some prefer not having to be tied to certain live lessons happening. They can choose to do it all at any time they want to do that. Others, quite frankly, had a bad experience with distance learning in the spring. And they chose to move to PLP at this time, and kind of they would like to see how it goes and wait it out and see what they think as we kind of progress with that. Those were really the main reasons that we received, but families could have other reasons as well.
Do you think that the families are well informed as to what happens if they enroll in distance learning now and then school opens and doesn't open? Do you think we need to give them some more information on that?
I think parents can always use more information. And as we go through this process, absolutely, it would be sharing with them, you know, if we're following the health benchmarks, there is a possibility that we could be in school and a couple of weeks later or however long later, they could come back with a recommendation that we need to close down. At that point, we will be going back to the distance learning platform, which is a struggle for families to figure out and for teachers to switch back and forth to, I have kids in my classroom and now I don't. I have to go back to recording all my lessons and getting everything situated. You know, one of the differences between distance learning and PLP you asked about, the big difference is this. On PLP, I have access to recorded lessons. I have access to the work that they're requiring me to do. And I will get a little bit of feedback because most of it is graded by the computer program. For distance learning, I have recorded lessons, but those I'm seeing my teacher. I have the work that would be required of my teacher, and my teacher is grading that and giving me feedback as to how I did on that assignment. And I also have live lessons with my teacher. Our teachers are checking in with students to make sure, is there something that's happening that you can't access or that you're struggling with or you're not understanding, to kind of help them access the program, but also access what we're asking them to do in the assignments. They do have available office hours, so as people have questions, they can call in and find out. They also have access to, as Mrs. Festadego talked about, was their special classes, their electives, our PE, our art, our music. They're actually doing some really creative things for kids to participate in. So the difference is really that connection with our schools and our teachers. That is really the difference between distance learning and PLP. And so I walked around to all the schools this week and looked at what they were doing. It is like every single employee we have is a first-year employee, because everything is new and everything is different for them. And they are collaborating more than they have ever collaborated in the past to figure out what's working for you, what's not working, how do we do this better for kids. Lots of questions with each other, questions of me, like, well, can we offer more face-to-face time, and can we do different things? So I think the first week is getting to know you. The first week is building community. It isn't as stringent as what we would expect as school moves forward and kids are in classrooms every day with their teachers. But it's also the first week and we're all learning together. As teachers move forward with this and continue to work on that platform, I was impressed what they were able to do with a turnaround of really a week. They had some time when they kind of knew it was coming, but we weren't back at school yet. And they really had a week to listen to what all the parameters were going to be and listen to how were they going to have to set up their classrooms? How were they going to have to provide the instruction? How were they going to have to provide office hours? In a week, they really came together, put all those things in place, got it going. And is it perfect? No, but even in our classrooms, it's not perfect. We work at that every day, really hard. So they're working on that as well. And I saw so many of them. It's funny that Mrs. Cox said she would have to re-record. There's a lot of re-recording going on. So they are working really hard to record those. And you know what? They're also working really hard to record something that isn't really long, because that's hard for kids to attend to. So it's really getting to the meat of that lesson and recording it and making sure that it hits all the points. And a student can go back, as we said, and review that multiple times if they need to figure out, I didn't understand that the first time, but I can go back and I can do it again. And then if I have more questions, I can call in during those office hours and figure out, I didn't get this at all. Most of your older students are able to do that kind of on their own with parent support. Our younger students, I'm in complete agreement. That is a whole different ballgame, and kids really do need a parent that's sitting there or someone that's sitting with them to be able to access that. We are in a situation where everyone is feeling the newness of what's going on and really trying to navigate it, how to do it the best that they can. It is the other reason that at the elementary level, we do require our teachers to check in every week with every student, because they may not be calling in. They may not have somebody there that's helping them. So we're trying to provide that support. I will tell you that as teachers find that out, they do spend extra time with that child. They do call them more often than they may others. They do try to figure out, okay, what other support can we get offered to this family, or offered through our interventionist or someone else who might have a small group with that child. Those are all things that they even in the first week when they were just trying to build community, that's what they were thinking. How do we make this better? How do we catch all those kids that might not be doing everything that we need them to be accessing and doing? I'm not sure if that completely answered your question, but hopefully.
Thank you, know that, I mean, y'all are obviously doing everything to put it together, and everyone's putting in their work and time. Much appreciated.
And the other thing I wanted to share with you kind of before we talk about options is we did conduct a staff survey, and we asked a couple of questions. The first question was, if we were to reopen to in-person learning on August 17th, please choose what you would most likely do at this time. For our certified staff, 62% said they would return to work. 14% said they would request to work from home. 2% would request a leave of absence. 1% would resign or retire if they were able to do that. And we had 22% who shared some concerns about returning to work. While they want to return to work, they shared some concerns that they have. Really, those concerns are very much the same as classified, so I'm going to give you the classified numbers as well, and then I'll tell you what those concerns were. For our classified staff, 73% said they would return to work. 10% said they would request to work from home. 1% would request a leave of absence. 1% would resign or retire if they were able, and 16%, although they would like to return to work, they had concerns. So the concerns were meeting the health benchmarks. They felt that was very important in order to say we were safely reopening. They were very concerned about social distancing and are we able to actually offer that. A lot of them had those suggestions about hybrid openings and having half of your students on campus for a couple of days or in the morning and the other half either in the afternoon or the other couple of days during the week. Lots of concerns about everyone wearing a mask and making sure that was important. That is in the roadmaps, but they may not have known that at that time. So that is one piece. And there is a significant concern about the enforcement of the safety guidelines and the protocols. What is the plan, or how will that be enforced if people are not following these guidelines? And I'm going to talk a little bit more about that with the second question. Our second question was, the student and employee roadmaps include mitigation factors recommended by the CDC, such as daily sanitizing, social distancing when feasible, face coverings, and requiring parents to check their students each morning and keep them home if they are sick. So we asked them to share factors that would support their decision to return to work. So when we were looking at our certified staff, 42% believe that cohorting students, and that's really that small group, kind of hybrid schedules that allowed us to keep certain groups together at all times during the day, would be important. 74% believe that smaller class sizes are extremely important. That also speaks to that hybrid model or cohorting model where part of your students are on campus and part are not. 76% said meeting the state and county health benchmarks was very important. And then 46% had other comments, which were very much the same as classified, so I will read those in just a moment. Classified staff, 20% believe that cohorting students was very important. 52% said smaller class sizes. 67% said meeting the state and county health benchmarks. And 35% said other. Here we also heard about everyone wearing a mask, that's very important to everyone, requiring social distancing, a hybrid model or smaller groups to allow for those smaller class sizes, staggered arrivals and dismissals, several comments about being worried about starting and stopping. So that constant, the intermittent closures, back and forth, students in and students out. They're very worried about that and the effect that it has on a student's education and really disruption to their whole process they're working with. The last piece, and it was A fairly common comment is staff are very, very concerned that parents will not screen their children or that they will send them sick to school. Much like it is now, there is no way for us to ensure 100% that that is happening. All we can do is work with our parents and ask that they are following the roadmaps, that they are following the acknowledgement, and that they are going through screening their children and making sure that they are not sick prior to sending them to school. Those were the main areas. You do have a small number of teachers and classified staff who did report that they were perfectly fine with reopening and not having masks. So then that brings us to the discussion that kind of needs to happen. So the discussion is really around, we know what the health benchmarks say. If we are following the health benchmarks completely, we would not at this time open to in-person learning. Your other options, obviously, are opening to in-person learning fully, or opening in a hybrid model where we decide numbers of students, what days would they come to school, or what portions of the day would they come to school. And I think all of that is a discussion as you are sitting here and talking about all those things that is important to have. Ultimately, if we're going with the health benchmarks, we would look at the one red, and we would not open to in-person learning at this time. But I have no guidance in terms of when might that turn green and when would we be able to open.
So,
Well,
oh, go ahead.
I was going to say, I have an idea to propose, and it would go along the lines of this. I propose that we, as a district, offer distance learning and our online academy until our percent positivity rate reaches 8%. Right now it's at about 12%. When it reaches 8%, we come back as a board to discuss reopening. And that is contingent on the other benchmarks, which are keeping on that decline of cases and our decline in COVID-like illness. That assumes that those other two benchmarks will remain green. The idea behind that proposal is that then we can be compliant with health department recommendations, and we can utilize the education opportunities that we already have in place for our students.
I think it really is all about being compliant, that's for sure. I'm concerned that, I'm not sure how the survey was written, but I have to say that I'm very concerned that out of all of our staff being surveyed, the overwhelming support of these as benchmarks. Nobody's concerned about the death rate. 5 people under 50 in Mojave County since this started. 5. And that doesn't even mean they died from COVID. It means when they died, they tested positive for COVID. It doesn't mean that it wasn't from something else. But I think it kind of highlights, here we are just being pulled around by the nose, and this propaganda that we're watching on TV every day, that this is our benchmark. This is not a benchmark. It just truly isn't. The more testing you do, the more cases you're going to have. So that benchmark means nothing. The percent positivity, same thing, means nothing. And then the COVID-like illness under 10% means nothing. These are arbitrary benchmarks. I really don't understand what they're based on. I just don't understand what they're based on. We had no problems over the summer with our children that were participating in the after-school program. Has anybody heard differently? Was there social distancing?
Yes.
I believe that their circumstances were quite a bit different in terms of being able to provide the physical space.
Okay.
Which simply is not possible for our schools. And that is one thing to keep in mind when we do reopen. Physical distancing really is impractical.
Why would you want-
We have crowded classrooms, we have crowded cafeterias, we have crowded hallways. That is going to be a fact of life.
We do know of private schools that aren't opening until at least October.
And my idea behind having the 8% as sort of our litmus test is that then parents could keep an eye on the data and have an idea of how close we are to that and plan accordingly. Because from what I've heard from parents, there are a lot of concerns, but one of them is kind of the uncertainty. They don't have a date, and so planning is very difficult for them. And I'm sensitive to that, and I want to take that need into account. At least if they knew what we were looking for as a board, that would help them know what to look for as well.
I think that's a very good way of doing it because this is something they can stay on top of just as we can.
And it might encourage community compliance with things like masks. I understand that masks are not part of our cultural norm here in the United States. I understand that. But I do have an article from JAMA, and I would be happy to email this to anyone who asks for it. But it's talking about the urgency and challenging of opening K-12 schools. And one of the things that it talks about is how a community can support that and help make that happen. And so it does rely on the compliance of the community, the mask wearing, the maybe not doing unessential travel, not hosting or going to parties. Those types of things will help us better prepare for schools to open. And again, I would be happy to email this to anyone who would like to read it for themselves. Although, just as a warning, my husband read it, and so it's all marked up. He's a monster. But
So I prefer 7% rather than the 8%. But what you're saying and what I've been thinking about is we could set a goal. And we really right at this moment are not that far away. The last I looked, we were at 10% positivity. That's not very far from the 8%. New Zealand got rid of it until about 4 days ago, and then all of a sudden 4 cases popped up, and they don't know where the 4 cases came from. But they absolutely got rid of it. And if we all contributed, we all pitched in, we all wore masks, we all watched our physical distancing and washed our hands, and if we test positive, we self-quarantine, we take responsibility for ourselves and the community. We contact the people we were around and tell them that they also, please, you need to quarantine yourselves for the next 14 days. I'm going to do it for 10 days. I think we could get down there, but it's just how much the community wants to do this. And my concern is that if we open up the schools, we're going to be a vector for the rest of the community. Over 5,000 students going back to school, 500 staff members, and then it spreads all over town, and the hospital rate will go up. I mean, there's no coming back. But if we could just take care of this one thing with such simple, we are at war with an invisible enemy that has invaded our country. And when you go to war, you usually have offense and you usually have defense. We have no offense. Even the tests aren't very usable, but we do have defense. It's the only thing we have, and we know that it works. So if we do that, I think we could bring it down.
Just as a point of clarification, when I said 8%, I didn't mean we would reopen at 8%.
No,
I meant
know.
we would come back and talk
That
about
would
it
be
at 8%.
goal, and it would still be 2 weeks, I believe. Once it hits, we have to wait 2 weeks. Once we establish that, we have to wait 2 weeks and see if it holds.
Well, I'm not going to conform, and I'm not going to do all that I can to change the way I live my life. If I die from COVID, I die from COVID. My husband has to go in and be at risk every single day. A lot of people have to go at risk, but it's easy for people who don't work or who are retired from work to say, if everybody would just do their part, we could get rid of this. And there's no evidence to suggest that. At some point, we're going to have to come up with an acceptable casualty rate, and nobody wants to have that conversation. But we have it on everything else, and at some point, that's going to have to happen. Because while we're all having these non-productive conversations, because we're just following these ridiculous benchmarks. I mean, I don't know how much more plain to put that. It's just so ridiculous. Life has to go on. People have to engage. Just because it's not you doesn't mean that it's not someone. And having a place for your child to go every day so that you can put food on the table, because if you're relying on the government to do that, you're in big trouble. I'm just saying. That's a real thing for people without a guaranteed income.
But they can enroll in this on-site program available August the 17th.
Oh, that must be so easy to
But
do
it's an
that
option.
when they could sneeze and then have to come pick their child up and then quarantine for 14 days. It's not as simple as we're making it sound, because we're not really having the deeper discussion. What is the acceptable casualty rate in the state of Arizona? Nobody will answer that. Why not?
What do you think it is?
I don't know what it is.
So you're one of the people who won't answer your own question,
No,
right? That's what you
I
just-
haven't done the science, but there is an acceptable casualty rate for students that die on buses, for instance. I don't know what that is off the top of my head. What I'm saying is we keep getting these numbers to use as a benchmark that don't mean anything.
They do mean something. These benchmarks were compiled by infectious disease experts, which I am
Based
not
on
one.
bad models that we're still using. Bad models that we're still using.
Models
The models
use
from
data.
Washington that said that we were going to have millions dead. We're still using bad models. So it's not based on good science.
I will cede the point that none of this is simple or straightforward. There are too many unknowns.
Right.
My strategy is to approach with caution. I understand that you have a different approach. That's fine.
It doesn't mean I'm not cautious.
I didn't-
Please don't say that I'm not cautious. But I'm not going to shame people. I'm not going to judge people. Do you see what's happening in our culture, in our society, for somebody seen without a mask?
No, I don't.
You don't?
No.
Well, it's very sad.
Well, you know what?
It's very sad what's happening to people who are being shamed for not wearing a mask.
Well, that's too bad, but that's a pretty mild consequence. If somebody is being shamed, they're not being put in front of a firing squad. They're not getting fired. They're not going to jail. It's just social shunning. It's been done ever since the Scarlet Letter and going back for centuries. It's just what
Right.
people do.
And I don't think our parents should subject their kids to that social shaming.
Well, it is. There's no subjecting. It's just what people do.
Well, no, if they send them to school, they will be subjected to it.
How?
There is bullying in school anyway.
That's
so I
right.
don't see, I think maybe they should just not send their kids to school at all then.
I couldn't agree more.
Well, it's like saying, why should we require that kids wear shoes?
No, it's
We-
not like saying that
is.
at all.
It is. We recognize
It's
that
not because the
safety-
science is not
I would
there.
prefer not to be spoken over.
The science is not
Shoes
there.
are similar in the sense that they reduce your risk. It might be a small risk that you step on a piece of glass or that there's a fire and you have to exit the building quickly. The risk might be small, but the stakes are high, and it is the same thing with masks. If we can require that kids wear shoes, if we can require them to wear special standardized shirts, we definitely can also require them to wear masks. And in fact, that is in compliance with the governor's order.
Well, I understand that, but like the mask doesn't fit on your face. You've touched your mask 30 times since we've been here at a minimum.
You're right,
So,
because- you're right.
So the more you touch your mask, if you're infected, the more you're going to spread it. The mask, there's no science for the mask. How come nobody wants to talk about that?
There is absolutely
Then
science for
send
masks.
it to me. I have asked and
I
begged.
actually have a compilation of 70 sources, and I will be happy to send those to you.
Okay.
But for now,
happy to see those studies. Yeah, for now, you can
Let's-
call the vote, you can do whatever you want, you're gonna
I don't
pass
think
what
we're
you
ready.
want.
We're not ready to call for the vote. I still would like to hear the emails from parents and the community members.
But I will say at some point, if we're not educating our kids, we're gonna have to look at staff reduction. You can't justify staff being home and keeping our kids at home. You
They are
can't
working
do it.
harder than they do in a normal
That
year.
is not,
They are absolutely working harder than they do in a normal year. It is not easy to learn how to do this and to provide online support
are you
resources for
kidding?
students.
You've gotta be kidding me. Maybe it's not easy to learn it for somebody who has not been pushing technology on our kids forever, but if you have been in Google Classroom for any length of time, this is a piece of cake. It's what was sold with the textbooks as being a piece of cake.
I would love for you
So-
to quote a teacher who will come in here and tell you that it is a piece of cake what they are doing right now.
Okay.
Maybe some of them don't have any apps on their phone and have not used technology.
I think for some it's harder than others. I did hear a story about a high school teacher who just, even pre-COVID, does this for his students. He makes all of his assignments online via Google Classroom. If they're absent, they can go in and access that. And that's the way it's been for a while. So for him, yes, it probably is a much smoother learning curve.
Right?
And it will get easier for teachers. But the workload is still the same. They still have to do the lesson planning that they would do in a normal environment. They still
But we
have to
could
find a
have-
way to present that to kids. They still have to monitor. We've just heard from our superintendent that they do weekly check-ins with every single student. We're
Right,
still
but we could
providing
have
counseling
one,
resources.
but we
We're
could
still
have
doing
one.
lunch and food service for all of our students. Don't tell me those people aren't working just as hard as they ever do, if not harder.
We could have one second grade teacher make all those videos. And we could have classified staff that support that teacher. One teacher for all second grade. What I'm saying is you can't justify to continue to do online schooling and pay the salaries and benefits that we're paying while the rest of the country is on food stamps. That is not going to happen in this town. You know that, right?
They are providing education. They are providing public
I
education
disagree.
to our students.
I disagree. I disagree from the parents that I've heard from that are in tears, the kids that are in tears. That is not what is happening, and it's not designed to happen that way. And this has nothing to do with our teachers. Don't make this personal about how I don't care about teachers.
You
I
just
didn't
said you
see
wanted to reduce
here.
staff
I
because
didn't
they're not
see you
working.
here before you ran for the board working on getting our teachers more money. So don't try to shame me about that. What I'm saying, the economics of it matter. Yes, we are in an economic crisis, but 5 deaths under the age of 50 in the last 6 months in this county does not justify what we're doing. We are destroying our country, and we're using K-12 to do it. Sorry, that's the way it is. And it's been a long time plan. This is part of why I was so against all the tech in the first place. Teachers are going to find themselves right out of a job because this can all be done online. All of
Let's
it.
move on to our emails.
The first email is from Naomi Severson. Dear LHUSD School Board, I'd like to offer some insight and share a few concerns I have for the children of LHUSD. We began distance learning this week. I'm a stay-at-home mom due to COVID. I also have a background in early childhood education. I personally welcome the opportunity to teach my children. On Monday, day one of distance learning, I had several children call me because both their parents work and they were unable to navigate the new process alone. They are students of our high school and middle school. They came from good, involved families. I had a house full of kids that really want to succeed but cannot do it alone. That evening, I was called by another parent, a single dad who could not figure out how to navigate Google Classroom for his first grader. As a result, his child will not be going to school this week until he can try to look at it over again the weekend when he's not working. My point is, for the sake of the children, as a district, you must work to have in-person learning by the 17th. I asked the question in the first board meeting regarding school closures. What will qualify keeping schools closed or from opening and closing throughout the year? Would it be dictated by the number of cases or only by executive order? Mrs. Romano gave a short response stating that the schools would only be closed by an executive order. I'm asking that you keep your word in this matter and consider all of the children of this district. Please realize that not all parents are able to teach. Not all parents can afford to stop working and accommodate distance learning. Please keep in mind the fact that many parents have to choose not to enforce distance learning in lieu of working to feed their families. Think of those children and what the outcome will be for them. The outcome will not be good, not only for their academic progress, but their mental health as well. They will be defeated and they will be behind academically. I am telling you that I am seeing this firsthand. This cannot be a long-term solution. Most children are not in the same situation as my children. Please open our schools on August 17th unless the executive order is extended. Please realize that the long-term implications of what we're doing are seriously detrimental to many students in the district. Thank you for your time and consideration.
I would like to just briefly respond. So the governor has mandated that each school district look at the ADHS data benchmarks and make a decision. So
Can I say something? Most of the emails that we received, I think we all received the same ones, are either saying to open soon or to not open soon, pretty much. If we are going to spend like, 3 hours listening to all these, and they were all very lengthy, because everyone has their own circumstance that they tell us about and so on, which is fine, but is there a way to curtail the reading of all the emails?
we could set a time limit if we wanted to, which we could do. If this was an in-person meeting, we could set a time limit. For the purposes of this meeting, if there are roughly 50 emails, I do think we should just plow through them all.
3 hours.
I don't think 50 emails will take, unless we're discussing every one of them,
Okay.
which I don't recommend we
Would
do.
it be possible for Mrs. Festadagle to scan and pick out what the point is, the paragraph that has the point?
It's kind of asking a lot of her to do that in real time.
No, and I think that could that could create problems.
Yeah.
Someone could say, you missed my point or something. No.
Could you forward all of them to us?
We could set a cutoff time. We could say it's 5:45 now. We'll hear commentary until 7 o'clock, which will
Yeah.
give us an hour and 15 minutes.
That sounds good.
Does that sound reasonable?
It does not sound reasonable at all.
Why not?
We have barred the parents from coming into these meetings, and now we're going to cut them off if they have something to say and not listen to their letter entirely. I suggest we take a break and we hear them until they're done.
Let's see where we are at 7 o'clock.
The next one is from Kendra Bell. My name is Kendra Bell. I'm a parent of a high school freshman and a high school senior. We've had a very good attitude about online school until today. This online learning, although the teachers are doing a great job, does not work. My kids and so many others I know desperately need to return to school. Watching both my girls cry because they aren't learning anything, and straight A's honor students getting D's on 2 math assignments is just plain unacceptable to me. We need to go back sooner than later. I understand the virus is a real threat, but the numbers are declining, and in my own personal opinion, made up. Let the people stay home that are afraid. Let the rest of us go back to our lives so the futures can stay bright. Thank you for your consideration. The next is from Kendra Strout. Our kids need to be in real school. They shouldn't have to be masked up like in a hazard suit. This interrupted their whole life. If teachers don't want to teach, let them stay home. When I was laid off from work, I had to find a job no matter what the field is. Same should go now if it's their choice. The masks aren't going to keep this crap away. Let them be kids. Parents who don't want to send the kids don't. Let our kids be normal. You have no idea how much trauma they already have. My daughter has seen me being suffocated before I was able to break free from her abusive biological father. This is wrong. These numbers are being reported are fake and made up. Yes, the virus is real, but it has been. Stop letting these people brainwash. Think for yourselves. Wash your hands. Don't spit and sneeze on everyone. It's not hard. Next one is from Mike Bell. To whom it may concern, I am requesting that our local schools open back up and that the mask requirement be dropped. Please understand that myself and many parents are not fooled by the media fear-mongering about the virus. We are not scared, not worried, and not okay with the current situation. If we can have daycare, then we can have school. If we can riot and burn flags, we can have school. These kids are the future of this country. Without our educators and normal school, our current situation will only get worse. For the families and faculty that are falling for the fake news and are afraid, have them do schooling online. Please understand that these statements and opinions are from an essential worker who has been working every single day like normal. We are not going to die if we go back to school. Thank you in advance. The next is from Katie Bell. Hello there. I'm a freshman at Lake Havasu High School, and I just wanted to message you about going back to school. I feel that many of us are struggling with our assignments, and our parents are doing the best they can helping us. Between working in their own lives, it is not going very well. So if you can do anything to help me and my family, that would be great. Thank you. Next one is from Corey Stalker. Dear board members, I am writing to express my concern. As a parent of a student at Stardline, please don't rush to open schools before they are ready for the guidelines, benchmarks set for a safe opening. I feel like if students have to wear masks to go back to school, then it's not safe to open. The next is from Lexi Bell. The community of Lake Havasu appreciates your efforts during this time. The COVID pandemic is nowhere near as bad as everyone thinks. Stop teaching children to have fear of something that should not be feared. Online learning may work for some, although it is a struggle for many. The teachers and their efforts are more than appreciated. I respect the people that want to keep their children home. I am sorry to the teachers that are afraid to go back to work. Both of my parents have been out in this pandemic this whole time because they are essential. I believe that teachers are essential. If my parents have to risk themselves, why do teachers get a choice? Does my mother have the option to be a nurse online? Does my father have the option to be a certified master technician online? If you haven't figured it out, the answer is no. What gives teachers the luxury to choose where they want to work? You're welcome from the essential workers that they haven't given into fear. If you want the education of students in Lake Havasu to massively decrease, feel free to keep teaching the unnecessary fear and preventing us to go back to school. If you want the students to grow in their education, give us the right to go back to school. You may argue that colleges teach online. What's the difference? Here's the difference. The mental maturity of a third grader and a college student is a little bit different. College students are adults. Children need in-person community to grow and mature both mentally and emotionally. Stop letting fear control you. Stop taking away our rights because you are wrongfully afraid. The next is from Sabrina McCready Walton. I currently have 7 students in my home, 3 in high school, 2 in middle school, and 2 in elementary. That's roughly 30 different classes in both Google Classroom and Remind. I was apprehensive, to say the least, between working from home and supervising all the classes. Fortunately, I was able to get the support that I needed in distance education. All of my children can navigate Google Classroom with minimal hiccups, complete their work, and attend a majority of their Zoom classes with very little assistance. Although there is a need to help my younger children with classwork and supervise them closely during school time, otherwise they turn in blank, incorrect documents or fool around in general. I'd like to express my gratitude to all of our teachers. I've been receiving excellent feedback and a great deal of help from several teachers and staff members. I've seen countless emails and I've continually received timely responses, usually within the hour. I appreciate the dedication of staff and I'm grateful for everything that's being done to assist myself and countless other families in our school district. Thank you. Ultimately, these are my children. It is my responsibility as a parent to make sure their educational needs and emotional well-being, among other things, are taken care of, even if it is a personal inconvenience. I view public education as a supplement to my children's overall education. I am the parent, I am the teacher, I am the social director, I am the accountability police. When did society decide that our schools are responsible for our children's full education, childcare, social life, health, patriotism, morals, and so on? Our school system is not a convenient parenting solution and should not be treated as such. I'm particularly concerned for our special needs students. Most of these children have vastly different needs, and a one-size-fits-all education plan isn't feasible. I'm concerned about the recent survey implying a glorified childcare setting for specific groups of students. A non-teacher supervising special needs students, 504 plan students at risk sounds catastrophic. Typically, these students need qualified staff members to meet their needs. Then to toss in essential employees' children as well, it sounds dangerous in my opinion. I understand there's a lot of pressure to get kids back in school. I'd like to know about continuing distance learning in the event that in-school instruction starts sooner than some families had anticipated. I'd like to see distance learning continue for those who aren't ready, able, or willing to send their children for in-school instruction. Our children should have the ongoing relationships with their local teachers and classmates despite their parents' decisions on what's safe for their family. Children should not be penalized for their parents' decisions. That's why we're making the big stink here right. Someone made a choice we don't like and we're upset with the fallout. Respectfully, every parent wants to make sure their children are happy, healthy, and safe. We all have the same goal, and I feel like we should be respectful regarding opinions, whether we agree or not. In closing, I'd like to say I certainly don't prefer this way of learning. I enjoy having my kids in a classroom environment with their patient and attentive teachers. However, I understand why our 2021 school year has started this way, and I'm supportive. I choose to model positive and accepting behavior in regards to our current schooling situation because I would really like to see my children model the same behavior in the future when things don't go their way. Catherine Lane. Good evening, fellow board members. I understand all we have to do to bring our children back. Safety for our students and ourselves is very important at this time. I have one concern that is bothering me. In the event that a student employee comes back to school and we are exposed to COVID-19 and we are now being quarantined for 2 weeks, in that last board meeting, it was stated that we will have to use our sick time for that 2 weeks. We are exposed, not diagnosed with COVID. Can you clarify this or tell me what I misunderstood? This shouldn't be our fault and our sick time should not be used. I could understand if we were diagnosed as having COVID, but not when we are sent home because someone else was. I understand why we are being sent home, but this does not seem right to use our time. I've worked with the school district since November 2003, and I love my job. For many years, I didn't take sick leave or personal days. I save my sick days so I can use it if an emergency comes up. 2 weeks of sick time really hurts us later when we are sick and don't have it in our bank. I know this will work out and look forward to seeing our students return to schools. The next is from Marsha Linz. Once school is in sessions, what protocols will be in place if a student is diagnosed with COVID? Will all students from that class have to quarantine the school? Will it all close again? The next is from Susan Davidson. Good evening. I understand there will be a board meeting tomorrow. With COVID numbers as high as they are, I'm not in favor of in-person learning at this time. Our students and teachers' lives are far too important to put them at risk. It is unfortunate that education cannot be our primary concern at this time because the lives of our loved ones need to be, but some things are just out of human control. We have amazing teachers, and I have full confidence that our teachers can provide education to our students online until it is safe for everyone to return in person to schools. We have to put their lives first. If the school chooses to reopen in person, how many children and teachers have to die before we shut down schools again? Is it okay if your child dies or their teacher? Is it okay if your child brings COVID-19 home and gives it to a parent, grandparent, or sibling who is already ill and fighting for their life? My husband has cancer and I shouldn't have to worry about telling my children they cannot go to school because I don't want them to get sick or possibly die or have them bring the virus home to their ill father, whom doctors say likely won't survive COVID-19 if he gets it. The school district should be telling the community that they are not going to be allowing the children and staff back into the school so that everyone can stay safe. In reality, the school should probably be closed until October 1st, and then things should be reevaluated at that time. Please keep our families safe by not reopening schools in person at this time. The next is from Joel Silverstein. I'm a biology and chemistry teacher. Writing, reading, and critically analyzing data is commonplace for me. This morning's news report came out highlighting the joint report from the American Academy of Pediatrics and Children's Hospital Association. The report, titled Children in COVID-19 State Data Report, is a compilation of the latest data of 49 states and the impact of COVID-19 on children. The compilation source is from the state level, best publicly available data on COVID-19 cases in children. The report for 8/6 and 7/30 are included for your reference. The highlights are alarming as this information directly affects our children, their families, their teachers, administrators responsible, and the community at large. Highlights. Nationwide, children represent 9.1% of all available COVID cases in the U.S. Overall, 501 children per 100,000 children are infected. 17 states report more than 500 cases per 100,000. 3 states report more than 1,000 cases per 100,000, Arizona being one of them. Lake Havasu's children population reaches 12% of all people. The city's population in 2018 was 55,000 people by the News Herald. The overall population yields a child population of approximately 6,600. Not all of these children are in Lake Havasu City schools. Some are not school age, some are in private schools, some are homeschooled, but they are children of the community nonetheless. Applying the Arizona rate to the children's population suggests that at this moment our city has or will have 72 children infected with COVID, whether or not testing has occurred. Based on this alarming, credible data, Arizona is not able to put children back into the classroom yet. The state has the highest rate of infected children in the nation. Consequently, Mojave County and Lake Havasu City are not able to put children back in the classroom either. Doing so at this time puts your entire community at risk. The governor has left it up to the individual school district to decide when and how to put children back in school. That is his get out of jail free card. He puts the responsibility on you. Since March 14th, our children have been out of school. Since this spring, the schools rallied quickly to put together distance learning systems and help salvage a semester. This August, our teachers and children are better prepared for distance learning. We have seen in the past week how well it's working. Of course, crisis is a strain on everyone. A crisis is not supposed to be easy. It will take incredible work to get through this pandemic. Considering that today Arizona has the highest rate of COVID-infected children, the governing board should not put a majority of these children back in the school buildings. Consider for the semester keeping middle and high school on distance and e-learning. The students with special needs can be provided for special accommodations on campus in limited settings. Elementary school children should be delayed until the rate of infection is less than 77% for 21 days rolling, and then brought back in small numbers. Then, while all this is in play, properly prepare for possible spring return. The board has a responsibility to every person in the city and our county. As cliche as it sounds, we are all in this together. Do the right thing, show the state and nation that you know what to do for the community. The next is from Melissa Waller. I know there are a lot of parents who are eager to have the buildings reopen, but I am hoping the board will make the best decision for all parties involved. If you decide to reopen schools as normal as soon as possible, we only have 3 days to prepare for that. And there are so many things to think about. Class layout, bathroom schedules. We have 210 primary students sharing a bathroom. Face covering procedures, drop off and pick up, normal prep of lessons and materials, supplies, cleaning, hand washing routines, lunchroom procedure, where to store masks, opening food, cleaning. A normal school day with all these procedures and restrictions is a long day for our youngest learners. These are a few of many things that need to be planned out. I just don't want the board to rush to a decision when the stakes are so high. The next is from Tanya Gray. Madam President and school board members, I wanted to share my thoughts on the vote from a teacher in the classroom. I adamantly ask that you vote against opening the school on Monday. Firstly, it may be possible to start with a staggered reopening. Elementary schools have fewer students and staff may have more need for in-person instruction. If we come up with a plan for recess and other high traffic times, we may be able to achieve this goal. However, it is impossible to safely open a school with nearly 2,000 students and 100 staff members. We do not have enough room in our classrooms to safely distance a group of 36 students. That's just my first period. This does not even consider the number of students moving in between classes in the hallway and eating together at lunch. Gatherings with this many people have not yet been allowed in our town, so we have not tested whether this can safely be achieved. If we do reopen so quickly without ensuring that we are ready to do so, the likelihood that we will shut back down and then reopen is all the more pronounced. Finally, we need more notice to reopen than a few days, both to work on lesson planning and establish safety measures. As a campus and in our classroom, we must have time to plan for a smooth transition and create protocols. I have heard it stated that teachers want to be back in the classroom with their teachers. Although I understand the sentiment, I absolutely do not feel this way without a plan to safely bring students back. I understand that students and parents may be struggling with distance learning, but we've been doing it for 1 week. We are just beginning to understand how to effectively use the tools available. I also believe that if parents were given a date for the start of in-person learning with logical reasons to support why we cannot open immediately, then they would be assured to make definite plans. This would alleviate much of the fear and frustration. Please consider the thoughts of a dedicated veteran teacher in the district as you vote tonight. This is from Jessica Supernut. Dear members of the board, my name is Jessica Supernut, and I currently have 2 children enrolled in Lake Havasu School District. I have 3 questions I will ask this evening. Please take a moment and put yourself in the position of parents and children when you're thinking about your answer. My first question is, how are you as a board putting so much trust into the benchmarks for school reopening when we are not provided with the equations they are using to obtain the percentages needed to meet those benchmarks? How do they get their numbers? Lisa, please elaborate to the board if they do not understand my meaning of this question. My second question is, can you as a board really rely on those numbers that are being provided when they are suggesting to meet the benchmarks as a whole county? We are a small community compared to the county as a whole, and city numbers are nowhere near the county numbers. Also, if they are using the number of positive cases divided by the number of people tested, that does not really reflect an accurate number as the county as a whole. Finally, is the fear of reopening full time and then having another shutdown playing a role of your decision? I know that Lisa feels this type of scenario would be more detrimental to our children than the current circumstances. Is that how the rest of the board feels? If so, can I just point out that we, the actual parents of children affected, do not feel this way? You yourselves have sat up there since March talking about how resilient and adaptive our children are. And in this case, how can you say that opening and closing again would be worse than their current reality? I know you all take your roles seriously and that you have intentions of keeping our children safe, but keeping our kids safe ultimately falls on the parent in any other circumstance. I feel like you should be looking more toward the parents for their answers and less toward the media and government websites. Please stop making our children victims of political blackmail and reopen our schools. Even hybrid would be better than what we are currently experiencing.
Only because she specifically asked a question of me. I do know I've exchanged emails with Ms. DePrennan, and I can give a little bit more background information, but I prefer to do that at the end of our email time.
The next question is, or the next statement is from Brittany Velasco. My name is Brittany Velasco, and I currently have 2 children enrolled in elementary school in LHUSD. The last week of distance learning has been one of the hardest as a parent. Like many parents in this small community, I'm an essential worker, and I'm not going to sit here and complain how hard it has been on me, because I know that it's been hard on anyone, and I will do whatever it takes for my kids to be successful. As a mom, it breaks my heart to see kids and other kids suffering from all this. They miss their community. The teachers and staff members and friends, our district really needs to see how this negatively impacts the children in the community. Think of the harsh reality that some of the children in our community are facing. As you make your decision, remember all of the children that are being left behind. Though this meeting is about children, I would like for you to think about the parents that can barely pay their rent and are now being able to pay daily daycare costs. Can you imagine what that might feel for parents? What are those children now going to do without making up the difference? Think about parents who have anxiety or depression. How do you think they're handling all this change? The decision that you make today is going to have a huge impact on our small community. I'm not going to bore you with statistics or numbers because you've already seen them. Please reopen our schools. The next is from Sally Patterson. My name is Sally Patterson, and I'm a single mother of 2. My daughter just started kindergarten this year, and my son started 2nd grade. I work remotely from home, and my job is fast-paced and very demanding. Although my children's teachers have done an amazing job thus far with distance learning, it just hasn't been a successful process in our home. It's very difficult to coordinate my work tasks and client calls in order to accommodate both of my children's needs with the schoolwork and Zoom meetings. Both of my children are disengaged and miss the school environment with friends and teachers who are trained at what they do. We need to open the schools back up and provide for our children the proper education and developmental milestones they deserve. The next is from Leanne Collins. Dear members of the board, my name is Leanne Collins. I currently have 2 children. Both of my children are on IEPs. My youngest is on 3rd grade. She can barely even read and is having a really hard time with math. She does much better when she's in class and has her resource classes that she can go to get extra help that she really truly needs and depends on. The shutdown of school has really had an impact on her. I can only do so much as I'm her mom and she wants to be in class. My son is a sophomore and is also having a really hard time understanding. He also has an IEP. He does much better with in-person learning than he can from home. He needs in-class learning. If they can't go back, maybe those with A through M go Monday and Wednesday, and N through Z go Tuesday and Thursday, if not all day, not half day. I know this is how another city is doing it, and their kids are getting something. Thank you, and I hope my words move you in the right direction. The next is from Chessa Fry. In response to yesterday's staff survey, I feel inclined to provide a more detailed response than the selections allowed. Like many teachers, I marked that I would return to work if I reopened. I felt that that was my only option as I'm not at retirement age, and working from home when students are at school does not seem possible. However, I don't feel that that response captures the stress, anxiety, and concern that I have for all those returning students. I'm a chemistry, algebra, and AP biology teacher at Lake Havasu High School, and my classroom simply is not equipped to handle social distancing that is required should students return. I have bulky lab tables that seat 2 students each, and the room is not large enough to adequately distance the 18 tables from each other. The hand sanitizer dispensers that the district has provided uses a product that is not alcohol-based, so is not adequate to protect the spread of COVID-19. 5 of my 6 classes are lab sciences, and there's not enough room to socially distance to do lab activities, nor do I have enough equipment for individuals to have their own. Sharing on lab groups is the only way I can do labs in person. I am further concerned about the crowded hallways and passing periods with the recirculated air with no windows in classrooms, and the current board stance on masks being optional rather than mandatory. Frankly, I'm worried about our kids. While COVID numbers may have approached an acceptable level, I am worried about an explosion of cases that are all but inevitable once we are back on campus. Please do not put 1,800 high school students and their families in the predicament of deciding between their health and education. We have alternatives for education. We do not have alternatives for a sick child or family member. I'm respectfully asking you to consider delaying our in-person opening until our numbers are lower when students can return safely. This is from Megan Ulmer. I'm writing you today with a concern of our safety and students reopening school. As I sit, I think about the daily adventure of a high school student from the time they enter campus till they go home. I can only think about all the unsafe scenarios we would be putting our students into One thing that stands out to me are the classrooms with multi-student tables. In a classroom with said tables, we would be putting 2 to 4 young adults in close proximity for 55 minutes multiple times a day, with class sizes being 25 plus and sometimes 30 plus would be impossible. Secondly, I think about classrooms that require hands-on learning, art, science, PE, autos, woodshop, band, drama. Classrooms in the district are not equipped with enough supplies for students to have their own. Teachers would not be able to maintain a safe classroom if they are continually having to disinfect, clean each student. Lastly, I think about passing periods in restrooms where students are not able to maintain social distancing due to the amount of students needing to access the same areas. I also think about surfaces that are continually touched as students move class to class: door handles, drinking fountains, sinks, toilets, desks, chairs, lockers. With that being said, I want students back in class. I just want to make sure that we are being responsible as we are doing this. The next is from Brian Ulmer. I'm writing you this afternoon concerned for our students. I am the CTE cabinet making teacher at Lake Havasu High School. For those not familiar with cabinet making, it's a career and technical education course offered at the high school, giving students skills and knowledge they can take from high school and enter the woodworking, construction, cabinet making industry. As you can imagine, we have a large shop at Lake Havasu High School. However, not large enough for 25 students to socially distance while working on a piece of equipment. Not only is there not enough space, there are not enough tools or pieces of equipment for everyone to have their own and not share during the class period. As a shop teacher, my goal is to be as present as possible in the shop setting, not having to wipe down tools every 2 seconds. To go without saying, but not during this time, it's when a preventable accident could happen. Let's move back into my classroom, which is approximately 25 by 40 or 1,000 square feet. By CDC guidelines, I can have 27 students in my classroom. This includes an area in which instructional materials, tables, and desks currently inhabit. When students enter my classroom, they are not supposed to use the hand sanitizer that is provided, which is alcohol-free and per the manufacturer's research lab, has not been tested against COVID and will not be tested until after October. For those who are unaware, benzocolonium chloride is the active ingredient, and it is manufactured for Buckeye cleaning products. However, it is known that benzocolonium chloride has less reliable activity against certain bacteria and viruses than either of the alcohols per CDC. How are we supposed to keep all 1,800 students safe in our hallways during passing periods when our hallways average 12 to 15 feet? That would equal 2 students wide during the passing periods. For those who have not seen our hallways during passing periods, you squeeze through sideways. What happens when student A tests positive after a few days or even weeks of school and has had 30 other students in their classes? I am working 2 to 3 times harder creating content, attending virtual meetings with other schools, and coming up with ways to get materials into students' hands. I want nothing more than our students to be safe. If safety measures that can be met, if the safety CDC guidelines were in place, I'd feel a little bit more at ease knowing that we are doing everything that we can do to protect students and their families. I know they all have families to go home to, whether that is elderly grandparents, parents, guardians, or even brothers or sisters. We all know someone that is immune compromised. This isn't about getting us staff members safe, it's about students. We miss them in our classrooms and our hallways. However, if something happens to them because we acted irresponsibly, we wouldn't get them back. We do not want that. Please think of students. I know you as a board have a very difficult task ahead. Please consider pushing back the reopening of school until after fall break or when safe. Thank you for your time. The next is from Leslie Hobday. Dearest board members, perhaps we could consider reopening our schools in the following manner: half the student body from 8 to 11:30 and the other half from 12:30 to 4. No one has lunch, but rather at home. Kindly and sincerely, thank you, Leslie Hobday. The next email is from Jennifer Tarnow. My name is Jennifer Tarnow, and I have a dual enrollment Lake Havasu High School junior who has begun dual enrollment 1 year earlier than the program allows. My son has always been a straight A student until that class where he missed an A by 0.6%. Currently, my son is enrolled in dual enrollment trigonometry. For a highly proficient math student, he is struggling with distance learning in this class. He needs interaction with the teacher and other students in order to successfully learn the material. My son also enrolled in his favorite elective, advanced woodshop. However, he cannot practice woodworking at home, so this class via distance learning is frustrating for him. I am seeing highly achieving, happy-go-lucky student turn into a negative and angry student. He is having problems sleeping and barely eats. I blame this on the turmoil he is going through academically. I'm very concerned about him. I'm confident that other families are facing similar issues. According to the Mojave Health website, positive COVID cases went down 25% in the final week of July, with a 0% change from the week before and a 3% reduction the week after that. The website also shows that children 0 to 20 have been 301 out of the 3,200 cases in Mojave County. That is just 0.09%. Furthermore, of the 158 COVID-related deaths in Mojave County, 5 have been under the age of 50. As we can reasonably deduct from this data, students are the least likely to contract or die from COVID. I would strongly urge LHUSD to reopen in person for our community. The mental health benefits far outweigh the odds of our children becoming infected with COVID. I am confident the community would be willing to pull together to retrofit classrooms as deemed necessary to reduce the possible spread of the virus. I am also in favor of a hybrid structure to get students back in school. Thank you for your consideration. The next is from Anna Ortiz. Dear members of the board, I have 2 children enrolled in Lake Havasu. Please reopen our schools. One of my children is very stressed about her assignments. First, because our internet back and forth, and then she said, Mom, I'm done. I'm not going back to school face to face. I quit. My tears came out and I started crying too. Please reopen our schools. Thank you. The next is from Adam Howell. My name is Adam Howell. I'm a parent of 2 Starline students. I'm writing to express my frustrations about distance learning. I understand this is a new process, and like all things, it's going to take some time. With that being said, it is not an acceptable replacement. My wife does most of the schooling, and I'm still able to pick up on this fact. Just watching the frustration my wife has, and my kids' experience tells me there's something wrong. Just an example, today's Zoom meeting was scheduled from 9:30 to 10. The first 7 or so minutes were spent on reviewing a story the kids were supposed to have read. The next few minutes, the teacher attempted to get the class talking about anything they wanted to. And a few students responded and then nothing. I tried encouraging my student to say something, anything. They just weren't interested. At this point, the teacher told the class they were going to talk amongst themselves, which basically consisted of random sounds and giggles followed by blank stares and silence. The teacher finally pulled the plug with 15 minutes let you go. I kid you not, the meeting ended at 9:45. From what I can tell, everyone wants the schools reopened. The teachers put in the hard work and currently going to waste. The kids just want to be kids, and the parents are tired of having to balance the roles of being the teacher and the parent. I see no good from coming from the schools being shut down. It's time we think about what's best for our children. We urge you to think about the negative effect that this is having on our kids. We should be encouraging curiosity and learning instead of turning it into a chore, which they can't stand to do. It's only a matter of time before these kids start to hate the idea of school. We need it to change, and the damage can't be undone. The next comment is from Allison Hendrickson. I hope this finds you well. I understand how challenging it must be for the ones deciding to reopen the schools. This can be especially hard as members of the community and the school board voice their concerns supporting widely different views and resolutions to the problem. As a teacher with an extensive medical education and background in pathology, I can tell you that the reopening of schools is just not safe for our students. Here's a list of reasons why our students and children are not safe to return yet. Too many students and not enough teachers. Socially distancing students will require small class populations. Many classrooms, including some of my sections, are experiencing up to 40 per class. This is 1 hour in close proximity to one another. Throughout the day, they will attend 5 such class periods. As it is, my classroom has 32 chairs, and they are about 1 foot apart. There is not any room left to safely distance with more than 15 students in my classroom, where there will be performing laboratories regularly. Due to the lab setting, my furniture consists of permanent fixtures. My class supplies for science are extremely limited, so students typically need to share everything, including computers. Many of these materials cannot be disinfected or wiped down because they are porous. There are asymptomatic carriers and no way of knowing that we're exposing students, or not until someone is already sick. Students will be exposed to the virus regardless of whether or not precautions are made on the campus. The students' health needs to be a priority over everything else, and we are not ready to provide all of the safeguards at this time. We cannot expect students and parents who are not educated in universal precautions or pathology to follow guidelines when they are already sending sick children to school before the pandemic. Sure, we can take temperatures and send them home, but thermometers are not always used accurately or properly. Thermometers can also spread the virus. We do not know enough about COVID to be able to send children back safely. Hello, my name is Nicole George. I have 2 little ones at Jamaica Elementary, kinder and first. Their teachers are amazing. Their teachers also want to go back to school in person. They have lives too. They are spending more time working on distance learning than they would be face-to-face. Your decisions and making plenty of parents withdraw their kids from school they are used to. Like them, I have started at another school. However, I have not withdrawn, hoping that you would look at the facts and statistics of Mojave County benchmarks. What numbers are you using for the metric? Why would we use total positive cases versus total tested to show our stats? Shouldn't it be total positive cases versus total Mojave County population, which would put our percentage testing positive way below the benchmark? Also, since you're going to be making the decision based on your research, why don't you look at the daycares that have been up and running with no positive cases? Isn't it amazing that no positive cases, just taking daily temps and cleaning more? Oh wait, they don't even have masks there. Wow, wouldn't we follow the protocols that work? You're making daily lives so much harder due to the unknown. Let the teachers who want to teach face-to-face, let the kids succeed and grow. I will not allow a computer to be the way my child learns. This is what they want. Our kids to be taught further away and strange materials to be introduced. I miss the traditional way of learning. We need to bring back the originality. Please use common sense and vote on reopening schools face-to-face. Here are some valuable links that say kids are safer in school by the American Pediatrics Board and the CDC. It's sad as a community, we already know how this voting will go. We need some people who are educated to vote. 3-1, can't wait to see it. What about a third party who can't vote? So if it's a tie, whatever you guys want, right, Lisa? The next is from Ashley Byerly. I would like to share my thoughts in regards to tonight's vote. As a teacher in the classroom, I ask that you vote against a plan to reopen on Monday. The notion that campuses would reopen on Monday leaves a lot to be determined with such short notice. Teachers need time to lesson plan and prepare materials that will adequately prepare and implement health and safety measures in the classroom and campus as established by LHUSD. There must be detailed thought put into the appropriate protocols for a safe and viable return. The established safety measures must give the appropriate length of time set in place and transition in action before students arrive on campus to be effective. I have heard that teachers desire to be back in the classroom with their children, and while that passion for students may be shared, I do not believe that there is a safe way to bring back our students at this time. The health and safety measures require it impossible to meet such a short time frame when you consider the number of students coming back to campus. At a school with nearly 2,000 students, there is no proper way to spatially distance within the classroom when you consider a classroom seating with arrangements of up to 36 students. I empathize with parents and students during distance learning. However, we have only engaged in distance learning for a week. Finally, I would like you to consider the image of LHUSD putting out the image that you are putting out to current and potential teachers and staff. If LHUSD is more concerned about the comments and opinions of the community rather than the safety and health environments of its students and teachers, it is sending the wrong message. Unfortunately, I think the image projected indicates that LHUSD is more concerned about the fear produced from the community than hazardous work environments of its most valuable resource, educators. It may be possible to reopen schools with a well-thought-out plan. This plan should address safety measures for high-traffic zones at all times of the day, like classrooms, lunches, hallways, passing periods. But until then, a plan is soundly established. A later reopening date must be considered. The next is from Rosetta Galinda. We as parents of Lake Havasu schools would like a choice to be able to allow our children to return to school. If not, the school should be defunded. The next is from Jenna Louder. Dear school board, you have heard reasons why the school should and should not be bringing students and teachers back in person. As a parent of 2 elementary children, as an educator myself, I would suggest that choice is the solution right now. Teachers who want to be back in person should teach in person. Parents who want to send their children back to classrooms should send their children back with precautions in place. Parents should be allowed to keep their students at home to work remotely. Teachers who feel at risk should be able to work remotely with remote students. Those who are finding the online program valuable should keep their kids in the online program. There is no one solution that will please everyone or keep everyone safe. I think families and teachers need to have the personal responsibility to decide what is best for themselves and their families. Furthermore, there are plenty of options for modified schedules that will allow for half of the students in the classrooms at a time. I would also like to give kudos to all of the teachers who are working hard to master the technology needed to teach remotely. It has been a good first week and 2 days. I am grateful for the dedication of LHUSD teachers and staff. The next is from Leah Ju. I see the benchmark about percent cases positive needs to be under 7% for 2 weeks. Are we going off Mojave County or just Lake Havasu? It sounds like the roadmap is not legal advice, so we don't truly have a decision. So we can just make up our own rules, right? The next is from Sarah Sletbo. My name is Sarah Sletbo, and I have 2 children in Lake Havasu City. One is entering 9th grade and the other is starting his senior year, both extremely pivotal grades. First, I would like to add that I understand the importance of our children's safety. I would never want to place my children or another child in harm's way, but there must be something more that we can do to open our schools back up. Both myself and their dad are essential workers and unable to present to confirm accuracy of the work. We also have had multiple issues with Google Classroom, for example, child getting removed from class accidentally by the teacher, not being given clear instructions on how to monitor the child's progress. I'm not placing blame on the teachers because I could only imagine everything that they are adapting to. We need our kids in school for many reasons, but education and social interaction are the most important for me personally. So much of our lives are being forced into the online world. This is the last impression I want for my children to have. We need our children learning face-to-face in person, which can be done safely. We also need to look into compiling data for our city alone, not the county. I appreciate your time in reading this. The next is from Marcia Cox. Considering COVID-like illness includes influenza, how will our community ever be assured that our district will open for in-person learning in the classroom? From June 5th, 2018 to June 27th, 2020, the district paid for 97 confirmed cases of influenza. You have no idea if any of these members reported to work. If we had closed our schools for confirmed influenza cases, we would not have had a 2018-19 school year. The next question is from Leah Ju. Why can't your online school support online classes in dual enrollment? The distance learning is not for us. I have 2 kids that take honors classes, and I have one that's doing dual enrollment. I don't know how much longer we can do distance learning. I feel like we are approaching leaving the school district if it is closed much longer. The next question is from Wendy Moore. How many sick days will students be allowed? I think it's set at 8 days, but I'm not sure. Will letter grade changes happen if they go over the allowed days? No, that was taken out of the handbook. The next is from Aaron Holmstrom. If the board decides that it's safe to open up campus for all schools to attend our schools, why would we need parents and teachers to sign a waiver pertaining to COVID-19? If the board has already agreed that it's safe enough for thousands of students, if it's safe enough to attend this in person. The next comment is from Natalie Livermore. I would like to take a moment to thank all of the administration, staff, and teachers for going above and beyond with our students. These are uncertain times, and while we all want our children to return in person, we must also take into consideration that returning and then having to close would be more detrimental and frustrating to kids. Once again, I would like to thank teachers for seeing to it that our kids are no longer on hold. It is not perfect, but growth is happening. The next is from Marcia Cox. There's a lot of detail spent on what you require from the parent to assure they are guaranteeing their child is not a threat to the district. What steps is the district taking to make sure that children can return to in-person learning? Do teachers even want children back in the classroom? I've heard from teachers from other districts that are demanding in-person classroom teaching, but not in our district. The legalese looks like you don't want kiddos back in the classroom. The next is from Leanne Schnorr. Why can't we open schools if parents are willing to sign the waivers? The next, it's not about this topic. The next is from Leanne Schnorr. I stand with everything Nicole Cohen says. She is the voice of our city and parents that want schools open. This is not enough learning for our children. This is not fair to our future. I'm crying sitting here looking at parents commenting on the board asking to be open and no one is listening. This isn't fair to our teachers either. You will open sports but not schools. Please listen to us. Open our schools. Let us sign the waivers. Thank you, Kathy Cox, for your voice of reason as well. The next is from Jennifer Ward. From personal experience with my child, 4th grade, doing this online class, it's difficult. Most parents work and are unable to be there for the Zoom or the office hours. It should be the choice of the parent as to whether they want their children to attend school in person or not. Suggestion, why can't they do half day? Some kids in the morning, some kids in the afternoon. That way the kids are there for at least 3 hours rather than at most 90 minutes a day, and it makes the class size smaller. The next is from Lisa and Ryan San Juan. You are hurting our children by not allowing them face-to-face learning. You need to resume their lives. You cannot keep them locked inside our homes forever. The flu kills more than COVID, and yet we never closed anything. Do you plan on keeping schools closed forever? Because COVID is never going to go fully away. Everyone gets sick. It happens. Not to mention parents who work full-time. We already have a small window to make dinner, shower children, etc., let alone now have to teach our children, especially the parents who have more than one child. We have essential grocery store workers who've been working through this all, and teachers are essential workers that need to teach. There are many schools that are opening and doing fine. If parents want to keep their children home and continue online learning, they can, but the ones who want to allow them to return to school should be able to. Let parents have a choice. The next is from Ivinya Anderson. Dear board members, I am a teacher of 17 years and a parent in this district. I'm invested in our schools. As we approach this integral decision to reopen our schools for in-person instruction, there are many variables to consider. How will children and staff be safe from the spread of COVID-19? Think about recess, lunch, passing periods. Think about students with asthma or underlying conditions. According to scientific medical data, is a sensitive factor if COVID-19 is contracted. Think about a classroom with 30 to 35 students, times 6 at the high school. Think about behavior patterns in elementary age students, how they will be able to follow safety measures. Think about the fact that symptoms may not be recognizable for up to 2 weeks. How will a daily function of in-person school look? Think about the enforcement of safety measures being balanced with behavior management and instruction of standards. Think about the time it will take to plan instruction for in-person learning, especially while trying to plan for safety. Think about social anxieties that students and staff may be experiencing in the classroom school setting. Think about what would happen if one staff or student tests positive. Will everyone they're in contact with have to quarantine? Will there be subs for staff? Will staff have to use sick days to quarantine? There are likely many other factors that I've not even considered. I know that I can teach my own child how to protect herself against the spread of the virus in a social setting. However, can I trust that all parents are expecting their children to adhere to implemented protocols? Can I trust that all children, even my own, will be able to adhere to these protocols? Those are unanswered questions. My personal philosophy has always been to err on the side of caution. We should not rush the opening of schools without more information. Perhaps with more time, we can establish a more reasonable in-person start date, at least after Labor Day, that will allow staff to prepare and will lend to better assurances of safety for families and staff. The next is from Marshall Linz. The teachers are doing an amazing job compared to spring at teaching these kids. Parents need to remember that it takes much less time to complete a lesson when one-on-one than it does for a whole class to complete. A homeschooler's life is not 7 hours a day doing work. Thank you for keeping our kids safe. The next is Nicole Brown. Hello, I'm Nicole Brown, mother and teacher of a 6th grader at Oro Grande. My son's teacher, Mrs. Nowakowski, does a wonderful job making videos, PowerPoints, and Zooms. She's able to help him after contract hours as well. As long as I have a contact with his teacher, I'm fine waiting until it's safe for the schools to open. The next is from Brittany Leanne. If we select distance learning at the beginning of the year, but do not want to send children in person upon reopening, what are our options? I assume distance learning will stop. Online school options seem to be changeable only at semester. Is it you must attend upon reopening?
Will you go ahead and answer that question?
If we were to reopen in person, we will find ways to continue the distance learning platform. We don't know exactly what that will look like at this point, but we will find a way to continue that. In the PLP platform, parents and students would work with their principals to determine when is most appropriate for them to return.
The next is from Chastity Leon. Thank you for the teachers doing an amazing job during this tough time. Also, thank you to the board for keeping our students, teachers, and staff safe. The next is from Marcia Cox. Are teachers that receive a stipend for extracurricular activities still receiving their stipend even if their club doesn't meet? The next is from Marcia Cox. Rachel's challenge is a big part of the district, and especially chain reaction week for sophomore students. During COVID, we have seen an increase in suicides, and Rachel's challenge goes a long way. How are we going to make sure this year's sophomores are not going to miss out on this?
So Rachel's challenge is still a conversation. They have contacted me directly to set up a meeting, and unfortunately at this time, with everything they are experiencing as well, they are only offering online virtual options.
The next is from Andy Nelson. Have the kids stay in one class, have them eat lunch in the room, send them out to recess at staggered periods. If there's a COVID outbreak, it is regulated to one class and does not affect the whole school and cause a complete shutdown. It would only be the one class of students. Missed the scroll. The next is from Leanne Schnorr. I'm completely disheartened. These people voted in, yet don't even take the time to listen or consider what's going on with children. Your image you're portraying right now is disgusting. When will this end? We cannot keep our schools closed. COVID is not going away. Can you please just give a goal date, something with any kind of a date? That might be it. Jennifer Hebb, please explain why and how swim can start on August 24th, but we cannot be in school. Swim is not more important than my children's education. Please advise.
Would you mind addressing sports? Could you take a moment to address sports?
Yeah, so currently we are following AIA guidance and guidelines as they meet and try to determine what can be open based on social distancing guidelines and things of that nature. And that is the current guidance we have from them. As with everything right now, they have also shared that that is certainly subject to change, should they take something else into consideration.
The next is from Angelica Castaneda. I have a 4th grader and a 7th grader with an IEP at Thunderbolt. We have chosen to do distance learning as we hope to go back sooner rather than later. Although this way of learning is not ideal and definitely difficult, I would like to acknowledge the effort that teachers have made. It cannot be easy to learn to teach this way. Our video lessons have been visually engaging with a nice lesson plan layout. Live lessons are a day we look forward to, seeing our teacher and getting to know one another. I can only imagine the time it takes to put this together. As a parent and essential worker, I completely understand parents' frustrations with the situation. I too struggle and have to email teachers with questions constantly. They have been great about getting back to me quickly and helping with their needs. Again, even though this is not the way I would like my kids to learn, I would like to say thank you to all of them for continuing to be there with my kids. This is from Jessica Klostemeyer. Dear members of the board, my name is Jessica Klostemeyer, and my daughter is currently enrolled in Lake Havasu District. I understand that we're trying to do what's best and safest for our students, and I want to commend teachers, students, and parents for doing their best. However, the negatives of keeping them home outweighs the positives. Yes, COVID is real. However, making our district follow these benchmarks are unfair. We are basing the requirements on data that is unfounded, science that is completely biased and censored. The numbers that are being reported are inflated. The media is doing nothing but pushing fear to get people to go blindly into getting the vaccine agenda is now being censored, and the doctors are being ridiculed and fired. If we are to believe in the experts, don't you think that we would be given correct information rather than keeping us in fear? To say that a mask is going to help slow the spread is comical. When they are referring to masks, they are referring to 95 grade. Homemade cloth masks, which are also which is also what the district is offering for parents do not help slow the spread at all. The droplets of the virus can go right past through the cotton mask, so asking to make children wear them is unrealistic. Also, keeping our kids home and not exposing them to daily germs are detrimental. Not to mention, kids are becoming discouraged, depressed, and agitated for having to stay home and not being able to socialize with friends. We need to actually open our eyes and see all the false information and get kids back to school and take our country back. We didn't shut schools down like this or anything for previous illnesses, even ones we didn't know about. I appreciate your time and hope that the board gets us back in school. From Christina Messelman. As a parent, my high school student is successful with Google Classroom. She has her work given on Monday, and she works at her own pace. She can check in with all of her teachers every day during office hours. She has live sessions with all of her teachers on Fridays. This is a highlight as they get to see who's in their class. She is an honors dual enrollment student. She is ASB president. While this situation is not ideal, she is hanging in there, enjoying the pacing and feeling supported by her teachers. Does she want to return? Of course. But at her age, she does understand that the circumstances, and she herself has asked me several times, what would City Hall look like? What would football games look like? What would it be like with social distancing? What she's struggling with no homecoming, just like spring had no prom, but with quality educators and family support, she will live on. 7 to 12 students continue distance learning, and they will make it able to work. My son, a 6th grader at Starline, is getting into the groove of Google Classroom. Last week, there was a lot of trial and error on the students and family. We worked together, communicated, and both followed the directions. Now in week 2, he's getting into the content. There's been some slight struggles. He's listening to teachers' videos, logging into homework help, and does have my support after hours to help him through an assignment. Overall, he feels like he's doing real school and is able to differentiate the glaring differences from the spring session. He misses school, he misses friends, teachers, and just like normal school, he gets it, but it's more of a struggle than rationalizing with a high school student. However, our family is making the best of the situation, staying positive and moving forward. Intermediate students can do it. As a 1st grade teacher, my families are working really hard, harder than I've ever asked them to work in the past. I'm recording daily lessons in all subjects, reading, language, grammar, and phonics, and math. I am doing my best to create primary-friendly assignments, drag and drop, pictures, fill the box, tasks which are created from scratch in Google to make learning accessible to all learners. I am offering consumable bags of resources that accompany our lessons, handwriting practice that was laminated and accompanied by a dry erase marker with math manipulatives. My students purchased a journal off the supply list, and they write in their journal daily. When we have check-ins, they are either reading me a journal page or they're telling me about they wrote or drew. I may not see this daily, but my families know that I will be looking at it. It will be a portfolio of progress. This is not a piece of cake. This is extremely difficult, but I am working on making it get easier every day. I am working to make sure that the platform meets every student's needs because I am essential, and this is my job to educate the youth. I am doing one-on-one Zoom meetings with every child in my class this week. I am assessing them via Zoom, sight words, math concepts, and I am providing 1 hour of homework help, not office hours, homework help, to my students daily who are able to log in. I'm providing 60 minutes of live lessons per week. I offered half an hour of parent help to classrooms of parents every evening during the first week of school with the communication via Dojo and lots of how-to videos, which I personally recorded. My families are in good communication with me, and we are making learning happen. As a teacher, primary students need to have face-to-face time. Students need live time with teachers. Half-day schedule, split groups, but we need to have face time with students. Mask shields, whatever it may be, we need to be able to communicate with our students in person. I would take the blessing of getting one 15-minute slot with a child with the barrier between us for those families that would allow it. Primary children K2 need to have a hybrid model as soon as it's safe. No lunch, no recess, no specials, just time with teachers, small group. I have 29 students in my class. This is year 2 who have no ability to access, this year, with 2 who have no ability to access tech. So they are on paper packets. I want all students to have access to my instruction. Please consider looking at a slow start. Let's roll it out slowly, safely, while continuing distance learning in Google Classroom in a hybrid model. In person, we will have a small time to collaborate, practice skills, and use manipulatives, not worksheet-driven, but application and practice of hands-on skills. A few hours per day would be better than 0 hours per day. Families who are not prepared to send children back will get the instruction. We can make this work, but please begin to look at the hybrid model. Let's go slow to go fast. The next is from Jeff Rayhart. Hello, my name is Jeff Rayhart. The kids don't need to go back to school. A lot of kids will suffer with this online schooling. They need classroom instruction. I'm an essential worker. I've worked every day of this pandemic. In and out of all these homes in Lake Havasu during the summer, everyone was crowding the lake and this channel. Parks, campgrounds to include Walmart, Lowe's, Home Depot. Everyone is acting like everyone in this town has been locked down in their homes since March. A lot of people have been out and enjoying life as they should. Life goes on, and you keep schools closed because of a virus. Our kids are losing the knowledge of not being able to do the classroom. Instead of arguing about this matter, y'all need to find common ground and work to get the schools open for kids for the future. A lot of parents aren't equipped with tools at home. Seniors that graduated got stripped of their high school proms, and what they looked forward to the most was crossing the stage and receiving the diploma. That doesn't ever happen again. Thank you. Have a great day. Christina Messelman says, I'd like to personally invite any board member to come join my team as we plan for distance learning. We can give you a glimpse into what this entails. The door is open. The next is from Ernie Severson. At this point, it's apparent where your members lie on the political spectrum. Keep in mind your constituency matters no matter what side you're on. It is abundantly clear though the majority of your end up in favor of reopening. I'm also aware the online program will be available for those who are in fear of returning. The numbers being thrown around are arbitrary at best and being used to instill fear. I'm a first responder who has been working through the pandemic. I am also in education and I've seen the haphazard way our system is being run. At this point, if teachers are not interested in returning to in-person teaching, they should begin looking toward Primavera or another online option. As a taxpayer, I'm no longer willing to pay their salary. The next is from Stacy Azar. Dear board members, my name is Stacy Azar and I'm a stay-at-home mom to 7 children due to the shutdown. My kids are kindergarten, 5, 8, 9, 11, and 12 grades. My kindergartner has been in preschool for the last 2 years, and now that online is not how school should go, he's beginning to have crying meltdowns every day that he has to do Zoom sessions and wanting to be in class. My 5th grader has autism. Trying to keep him focused on a Zoom lesson is close to impossible. This shutdown has caused major regressions for him, not only in academics, but socially as well. I have already pulled my older 5 children out as my husband and I were not willing to play your games anymore. Unfortunately, I have no choice with the 2 youngest. You are hurting children by keeping them out of school. This on-site supervision is a joke. You want children to be in school but have no instructional time, no access to their required Zoom sessions, no socialization, or no recess. How do you expect to have successful children when you continue to deny them a proper education? Please reopen our schools. You've already given an option to parents who don't wish to have their children in class, so give those parents that wish to have their children in school their choice. That's it. And just a reminder for people to make sure that they are emailing with their first and last names or names. Otherwise, I'm not reading them. Okay.
Could I make an observation?
Yes.
There's some people mentioned that, or several times this has come up, that we could do both online, a teacher could do both online and in school at the same time. That's not an option. A teacher can't, teacher right now who's doing distance learning, when we do go back into the school, into the classroom, that teacher's going to be doing that kind of model of teaching in front of her kids and cannot be planning the online lessons. So we just have to be, does that make sense? Do you have a question on what I said? So we're not going to have the same staffing that so we don't have all the options. Could they then just go over to the PLP school, or will that still have the same problem? The kids, could they?
And anyone can transfer over to the PLP schools, that's fine. In terms of distance learning, we do have a number of teachers who would be required to stay at home for medical conditions or things of that nature. We would be asking them to continue that distance learning model.
But it might not be the same teacher. kids have now.
Correct.
For parents who choose to stay with the distance learning. Okay, I just wanted to clarify that. And then Leanne Schnorr, I think she made ask for something that's very reasonable, and she wanted some certainty. She wants a date that they could come back. So I'm going to just throw out a proposal, and that would be we're going to have a lot of opportunity to watch. There are other districts all over Arizona that have gone right back to in school, just like that. Next week, they're going. So we've got some time now to watch and see what's happening to the health, the statistics and all of that kind of thing. Other states are doing the same thing. Just start looking at Georgia. And then that'll help us actually have some real facts in real time to see what the effect is. So while we're doing that, I would propose, and this is kind of an arbitrary date, is that we say that we will not go back in school until the end of first quarter. And before first quarter is over, we would have some time to take a look and see what's going on, and then a little time to prepare if we decide, okay, let's go back. But that's my proposal. I'm just not doing that. I'm not doing like a motion. I'm just throwing that out there to see what you think.
So if we did it after fall break, again, this would be like
When
reevaluation,
would fall
but
break
the
be?
earliest they would come back to school would be October 12th.
And then when is first quarter over?
Well, it ends when fall break
Oh,
begins.
do they?
Yes.
Okay, all right.
So
okay.
so I guess the last day of the first quarter is October 2nd, and then
Okay.
that entire following week is
Let's
fall
just,
break.
I would then change that to after fall break. Does that work on the calendar? The first quarter of fall break, I'm just saying calendar-wise.
I don't object to that, except that if our numbers get better, we do have some reasons to be hopeful here in Lake Havasu. Our hospital capacity has stabilized. Our local infection rate is on the decline, so that part is also good. And then just nationwide, we are learning more about the disease. We are coming up with better treatment. We are able to provide better outcomes for people who do get sick. As Nicole has mentioned, the mortality rate is low, and that's great. It does kind of ignore the fact that there aren't just two options when someone gets sick. I know I am adjusting my mask a lot, I'm sorry. It's not you get sick and you get better, or you get sick and you die. There are all sorts of outcomes in the spectrum between. We're learning more about cardiovascular damage, pulmonary damage, damage to liver and kidneys. All of those also factor into our equation of unknowns. And so I kind of am coming about this the long way, but in response to your October 12th date, I don't object to that, but I wouldn't mind revisiting the issue earlier, particularly if our benchmark data suggests that we are improving substantially before then.
Right, so the motion I would make is that just so parents know, they might have a family member who, knowing that it would be worth it to them to come out here and help out or something, so they would at least know that we won't go back. Well, I guess that's different from what you're saying. I would say we won't go back till after fall break. But if you want to say we would revisit it earlier, I'm not really opposed. I just think it'd be an easier thing to do.
What are some other thoughts from our board members? Do you have a preference on?
You don't really want Kathy saying is correct, because when, rather than online now, it's probably another teacher, and then you'll be in class with the same teacher, and then if we have to discuss it, then you're back again online and back to, so whether if we went all the way to October 2nd, then at least that 1 quarter stays, with one mode of learning.
Mhm.
And then, by then, hopefully we know better. But on the other hand, we can always keep it open to, going with that 8% and reconvening on that and seeing if that makes sense. That's good having that.
We could put in our motion reconvene on October, or say prior to fall break, so maybe that last week of September. Reconvene that last week of September, or when our percent positivity reaches 8%, whichever comes sooner. Does that sound okay? And I did want to come back to a couple of the comments because I said I would. Ms. Suprenant emailed me and said that the cases in Mojave County were, and I'm going to just use round numbers, but the cases were around 3,200, and then the population of Mojave County is about 212,000. So she said if you divide those numbers, you come up with an infection rate of 1.5%. Okay. We are hearing from the health department that our percent is around 12.2%, I think is the exact figure. And she was wondering why is there that difference? Now, we had a chance to meet with the liaison from the health department, and he talked about PCR cases. I'm keeping in touch with him, and I can email out his specific response. I don't want to even attempt to recreate his answer because, as I've mentioned, I am not an infectious disease expert, and the wording matters. I want to speak precisely, and I can't because I don't truly and fully understand the issues that I'm speaking about. So I think that you deserve to hear the exact reasoning behind why those PCR cases are preferable to doing the percentage the way Ms. Suprenant suggests. So I will keep our fellow board members and our superintendent apprised of that, and we will find a way to get that information out to people. The other thing, I was asked a question about what happens in the event that our vote ends in a tie. So we make a motion. If there is a tie, then that motion does not pass. It doesn't just fall to one board member to then decide what the outcome is. The other thing, back to speaking with the health department liaison, I did ask for numbers specific to Lake Havasu County or Lake Havasu City because I felt like that would be just sort of more personally relevant and applicable to our community. That is not the way the Mojave County Department of Health or any county Department of Health calculates their statistics. They do it countywide, and from what they said, they are not able to provide data that's specific to city in the way that I was asking for. I think those were all the specific questions that I saw that I wanted to respond to from the emails. Okay, so back to our motion. Do you want to make an official motion, or do you want me to?
Why don't you make it, because you just worded it the way I would say it.
Okay. I move that we monitor ADH benchmarks until the PCR rates reach 8%, or until the last week of September, whichever comes first. During the interim time, we will continue to offer distance learning and our online academy option.
But that we would not, we will take a look and decide what our next step is.
Yes, we're committing to reconvene specifically again in that last week of September, or if the PCR rate reaches 8%.
Harry, is that clear?
I would open this up to our directors if you have a professional opinion that you would like to give, or to our superintendent if she has anything additional that she would like to add. And it's okay if you don't want to speak. I just wanted to make sure I had a chance to get opinions.
You know, is there something we're not seeing here, something we're leaving out?
From what I'm understanding, the motion says we will remain in distance learning or the online schools PLP. We are offering on-site support starting on the 17th for those families who need that. And the board will monitor the Arizona Department of Health benchmarks, specifically the PCR rate. We would like to see that below, once it reaches 8%, if that's before the last week of September, we would meet to determine if we can reopen at that time.
I will need a second on that motion if we're going to vote on it.
I second.
Any discussion or any alternate motions that people would like to propose?
I would definitely encourage anybody watching to research the PCR tests so that you can feel confident that that's not going to provide us the data that we should have. Very sensitive, picks up on fragments, like I said before. So the idea that we're even using that as a benchmark seems unbelievable to me, actually. It really does.
Well, let me clarify, is the PCR, that's a new term to me, is that the same one that's in the benchmark that was submitted by the Arizona Health Department?
That's our percent positivity.
That's the metric.
Yes, if I understand correctly, and that is a big if I understand correctly, that number is calculated with the number of positive rates divided by the total number of people tested.
Okay.
And I don't even want to venture a guess.
Yeah.
And
The
we did
PCR
ask for
was never-
further clarification from the Department of Health, and when that is provided, I will send that out to all of you, and we can certainly publish that to the public as well. And I did want to share for Mrs. Cohen specifically, we did ask for peer-reviewed studies. They are supposed to send those to us. Perhaps I'll have them after this meeting. I can't be sure of that, but as soon as I have them, I will absolutely share them with the board. And if the board so desires, I can publish those for the public as well.
I think that we should just postpone this until next Tuesday's meeting, at least so that we can be on the same page with what we're actually looking at. I mean, we're using a PCR test that was never designed to diagnose these types of diseases. It was designed to be used in the lab, not for testing for disease. And if it's picking up on COVID or corona that's been in our system for a long time, then we're making decisions detrimental to our community based on this test. I just think that we should at least have somebody here from the medical field that can answer some questions, somebody from the health department themselves. I mean,
Well, there's something else wrong with those tests too. In Arizona, people have not been going in and getting tested at the same rate that they did earlier. And so it's almost like, not exactly apples to oranges, but the results are skewed. And some people think it's because it takes too long for the test results to come back. And by the time they come back, you could have been exposed to COVID. So what do you know? And then somebody was talking about long lines. I don't know. I haven't been tested. But I mean, it's skewed. They are imperfect. There's no doubt about it. I know. But I'm willing to go back. We don't have to vote tonight, but at least the public kind of sees what the thinking is right now. We're meeting again on Tuesday night for another board meeting. Is it too late to add an item to the agenda, though?
no.
No, it's
Okay.
not.
Don't,
So
I just have a question
Okay.
for all of us. Don't you think it's important that we know specifically, precisely what we're measuring and what we're looking at? Is there any way that we can all submit what we think we're looking at and then have somebody guide us through that? I mean, these decisions, even if they're not supported by the governor, even if they're not supported by the teachers union, but something real that people can go and look at themselves that is not subjective. I mean, it seems like as an educational institution, that should be part of the goal. Because that way, if you're saying we can't safely bring people back, which I'm saying you're never going to be able to safely bring people back. That's just not how our world works. It's a very dangerous place. But it seems like we should all agree that these are the metrics that are important. And I don't think any of us would agree that these metrics are important if we truly knew what they meant. Not a whole lot. So I just think it's important that we are very clear, and maybe that doesn't happen, at next week's meeting. But I feel like this is really important to get right, and I'm not sure how else to do it. And
I'm sorry. I don't think that we should be researching metrics and all, because there's so many different metrics and there's so many different opinions, and we don't know who is right and who is wrong. I think we need to go by
Science?
Science according to you isn't science according to me, so let's not waste time on that. So let's just focus on what's given to us, and with
Propaganda.
that, I'm not prepared to go into further details of what you think and what anyone else thinks. No, thank you.
But see, the problem that I have is that it is totally our responsibility to make a decision that has evidence to support it. And I know you've got studies, I've got studies, I know that Dr. Stone has looked at some things, I'm sure everybody in this room has, but we've only had conversations based around the narrative built in by the media. And that's a problem for me, because there's more to it than this. I mean, we've got people in the medical community here. Would you leave, your livelihood to have decisions made by people that would not provide the evidence to justify the decisions they were making? Wouldn't you question
To be
that?
fair, I believe that they have provided, I believe that the Department of Health has a justification for using the statistics that they use.
Okay.
I just don't understand them enough to explain them to anyone. It's not that I'm not willing to rely on these numbers. It's just, if you're asking me to communicate what everything means, I'm not sure that I can do that precisely, and I don't want to
Well, I
guess
think it
and say
generally
something wrong.
starts with the mortality rate. And we don't discuss that at all. That doesn't even seem to be in a check mark on the box for sure.
Again, mortality rate is not the only thing to consider, because
I'm
it's
not
not
saying
just,
it's the only thing, but it's
Okay.
not even part
But
of the
can I-
consideration.
may I-
That's the problem.
I
We
wanna make
shut
a-
down the whole county.
I want to make a comment about mortality rate. That too is skewed. A lot of people who died here in this town, suddenly, young people, just suddenly, just like that, that's very unusual. And so the death certificate reads heart attack or stroke. There was no autopsy. If you do some research, you realize that this is happening all over the country. And when they do the autopsies, they see the blood vessels throughout the body full of blood clots and things like that. We don't know the mortality rate, and I think it's much worse than what we're getting because of the COVID.
If I were to get a medical opinion, I would like two opinions, and they might be totally different, and they're both based on evidence. I really think we need to cut this short, and we need to focus on, instead, let's discuss more things like what we can do extra for parents who have children with autism or different situations. I would much rather I don't mind if we sit here for 6 hours and discuss each person's situation and try to find, different solutions for them. This macro level discussion is not going to go anywhere, because it's all skewed by all kinds of news, and I don't really want to get into that.
Well,
Okay.
I think someone said, a comment was, this is all political. I still don't get the connection between why I wear a mask and that tells you my political beliefs. Somebody will just have to explain that to me, but it's not political. This town is very divided, and it's not a healthy thing. It's not a healthy town because it's so divided. And I think that more information, even though a medical professional, even though I might not agree with him, or Nicole might or might not agree with him, but to have someone come in and answer questions and have the public hear it, and at least that's a medical professional in the public health field, hopefully, answers those questions, and then we move on. We either don't accept that or we do accept it. But right now, tonight, trying to cut that off, I don't think it's I don't think it's the right course. I think we need to try to bring the community together, and there's only one way to do that, and that is through education. And we all hear the same thing. And hopefully, as we all hear the same thing, it will clarify in our minds, and we'll all go away feeling a little bit more educated Tuesday night if we can just get somebody here. But I understand, I respect your opinion, but I just feel like we need to try to bring people together in their thinking and have some kind of way of having confidence in some kind of statistic.
The health department together, I don't know how many people it consists of, has come up with all this material.
I know that.
And here we are going to base our thinking on that, rather than get two different people, or one or six, from the health department, one who has one opinion and one who has another.
Well,
let's go with the consensus of the health department.
Well, let me tell you what my doctor told me about the health department. So I don't like this, but I'm going to say this. When this thing started in March, if someone had the virus, you know how many snowbirds we have here, and snowbirds waited, they decided not to go home. It was going to be safer to stay here. But they got the virus, and the only thing they were asked is, show me your driver's license. Well, if you're from the state of Washington, the statistics went on the state of Washington. The statistics did not go on the state of Arizona or on Lake Havasu or Mojave County. How can we tell anything from that? That is so screwed up to have a state that has a health department that figures things out that way.
But
that's
is
wrong.
how it is. Nationwide, that's how it's done.
I hope not.
It is. That's the way it's counted.
But then how can
They had to do it that way because otherwise you run the risk of double counting people.
No, I understand that, but there ought to be some way that we know real statistics here in our town, in our county, in our state, and we don't, and we're making decisions based on things that, to me, are not real statistics.
Well,
Okay.
unfortunately, there is that element of politics or whatever it is that's giving us all kinds of information. It's very hard to do, but I can tell you what my husband's opinion is, and I'm sure that Lisa can tell us what her husband's is, and even they won't agree on everything. So
I know.
forget it. I mean, I'm just telling you, forget it. I speak to doctors socially very often, and no one agrees on it.
But yeah, but here's the kicker. But we all agree that we're going to accept the three metrics
Yes.
that don't mean anything.
No, we've never said that they don't mean anything. I do believe these mean something. I just can't correctly interpret or explain that. And so, although I am comfortable relying on the benchmarks that are provided by the Department of Health, I do think it would be beneficial to have a representative of the Department of Health here at our next meeting to help us understand truly what they mean and help us communicate that to our public. Because our public they have a lot of questions just like everyone does, and I think it would be helpful for them to hear it from the horse's mouth, so to speak. Now, we do have to vote on something because as it stands right now, school is set to resume on August 17th, which is next Monday. So if we are going to delay even until the following week, we need to vote to do so. And I did want to make one more statement, and then I think I will have said everything that I have to say on this for right now. Our teachers are not just essential in the sense that they provide an essential service. Some of them, because of their skill set, are nearly irreplaceable. They have decades of experience, or they are credentialed in very hard to fill positions. And I'm thinking specifically of higher level math, higher level science, Spanish, special ed positions, our bus drivers, and all of our specialized instructors who teach cabinet making or preschool education. And so we've heard from our teacher survey results that between 1/3 and 1/4 of them are unlikely to return if certain safety protocols are not put in place. We cannot safely restart school with adequate supervision of our students if we have our workforce diminished by 1/3 or 1/4. And if I'm looking at long-term with like a wider lens, this is not best for students. Jeopardizing our workforce, forcing them to choose between their jobs and their health or their family's health, will cause many of them to choose their health. That is the decision that I would make if it was put to me that way. And so if I'm thinking about long-term, acting in the best interest of our students and being able to provide education for them, again, long-term, preserving our workforce is a key factor in my decision.
And the same goes for parents' decisions. You know, we don't want them to feel like they have to send their kids back, even though they don't feel safe about it, and yet they might, because they have to make a living. So it's all very complicated, and I think we need to simplify this at our level and do whatever we can. And that means I'm happy to work with, you know, like trying to figure out how to help different situations and things, and we've got to take things as they are.
I have two thoughts. One is, I'm going to give some information for our next meeting, but the second thought is, we've already determined that we have staff that would be willing to work from home, that don't want to come back, and parents that would feel more comfortable with their kids staying at home. So I don't understand why we wouldn't open up for those who feel comfortable coming back.
We can, as long as those numbers are roughly equivalent. If we have like 90% of our students coming back, but only 75% of our teachers, you can probably see how that would not work.
Well, I thought that that's what all the surveys were, was to determine those numbers. So
The last survey was just to see which parents wanted to have this in-school program that starts
well,
the 17th, but not more than that.
I don't have the staff statistics in front of me, but it seems like that we should have been prepared to answer that question, because we have people who want to do both, and we should do that. I mean, it would allow us to test and, you know, to make sure that it was working well, to maybe make the other staff that don't want to come back feel more comfortable, and the parents of, you know, young kids that don't feel comfortable.
And we might see a little bit, because we are going to be offering on-site supervision starting August 17th, we might see a little bit of that, like kind of a trial run, the soft opening that some of our emails have mentioned. And that might give people a better chance.
But we just listened to some pretty compelling emails from families that are desperate for our schools to open. And it seems like we should be doing that, and that everybody who doesn't want to come back shouldn't come back. And if we have a problem with it, staffing wise, we're going to know real quick about that. And then the other thing, before I forget, I wanted to be sure when it comes to this PCR testing that everybody is all over. PCR, polymerase chain reaction, and the inventor of the method, his name was Kary, Kary, B as in boy, Mullis, Mullis. And I would encourage people to research that test, because it was never designed to be weaponized, is what I'm going to say, and used the way it's being used. So with that being said, anything short of opening up our schools for those who want to come back, I don't think we can justify it. And that's where I'm at. So.
I will withdraw my motion, and I believe you seconded it. Would you be willing to withdraw your second? Okay. How about this as a motion? And I know it's going to be just seen as sort of kicking the can and delaying our decision yet again, but we really are committed to getting this right. I move that we delay reopening school until at least August 24th, that we reconvene on August 18th at our regularly scheduled general board meeting to hear further information regarding these benchmarks. and make a decision at that time.
From whom?
From the Department of Health, that's a good question. The Arizona Department of Health Services, in conjunction with Mojave County Department of Public Health.
Do you think you can get someone here?
We can definitely have a representative from Mojave Health. I can't speak for Arizona Health Department, but I will call and find out.
Maybe I'll put an either or proviso in there so that it could be both people or one or the other.
And if they can't come in person, maybe we can have them on.
Yes, in person, as we've all said, in person is preferable because then we can ask questions in real time, although we could do that remotely too. Does anyone have anything to say about that motion? I mean, well, actually, we have to second it before we can discuss it.
I second.
Okay. Is everyone comfortable with the wording of that motion? Is there a way I could make it clearer?
I think you could just say, we are not going back to in person on the 17th. That will be decided later. Rather than put that date of August 24th, because I don't really think if we do go back, I don't think it's going to be on August the 24th, because we need a couple of weeks to
I see what you're saying.
plan.
I agree. In fact, what you had said previously might make more sense, that we will bring this up at the board meeting on the 18th, but then we would go back to looking at if those numbers are adequate, to looking at the number being lower, the previous thing, or October, whichever is, September, whichever is.
Okay. So I forget the August 24th date. Just say reopening in-person school is suspended until we can meet on August 18th. Okay.
Harry? You want a second?
Second, I second.
So I have a clarifying question.
Mm-hmm.
It's a recommendation that the health department is not going to shut us down if we don't follow their recommendation. Am I correct in that? These are not mandates, the checklist. So if we're at, what did you say, 12%?
I believe that the exact number is 12.2.
So if we came down to 9%, we could open if we wanted to, and the health department isn't going to come in and shut us down.
That is my understanding. The recommendation is that to open for the first time, they would like to see that at 7%, but really it is in the moderate category if it's below 10.
Okay. So I just wanted to make it clear that this is the local control that we're supposed to be able to exercise, and even though those guidelines are there, we don't have to follow them.
True.
Well, I appreciate having local control.
Well, let's use it.
We are. And we're considering health department guidelines. Both of those things can be true.
Mm-hmm.
Okay, so we have a motion on the floor. Any further discussion?
So that motion, the intent is to actually make a decision next Tuesday.
Yes.
And then it's still going to require 2 more weeks, you say, to prepare for it? We're not prepared to open at all?
I don't know as we're not prepared at all, but we will need to survey our families and see how many are going to continue to stay on distance learning, which will allow us some opportunity to determine what staff is available for that, what students are available for that, which we can do in this next week here. And then also making sure that everyone their rooms are prepared. For the most part, they are. When I walked through the buildings, they are. And I think the big key here is teachers are very worried. What they would not be able to do is provide complete distance learning for kids and complete in-person learning for kids. So we have to figure out how to make those two options available if we decide to completely open.
And we could have some other models. For example, doing it incrementally, we might open up kindergarten and first grade first and get the physical distancing right, because we'd have lots of classrooms available. And then if that went well, then we could maybe add second grade. The high school may stay on distance learning, or the middle school for the rest of the year. I don't know, I mean, there are lots of options. My concern right now is for the little ones.
Well, I would say a majority of the pushback from teachers was at the high school level. It wasn't the elementary school level. So it just seems like after looking at the teams, I wasn't part of any of these teams, but it seems like we would have a plan in place for both at this point, 6 months after, we started this, and now we have to wait. And the emails that I was reading were like, we're not ready, we have to prepare. Well, I don't understand why we're not doing that behind the scenes, regardless of what the state tells us we can or can't do. Like, it seems like we would have been doing that.
I think there are a lot
Along.
of conversations that are going on among the staff about the possibilities they have. But these benchmarks just recently came down in the last few days. I mean, that kind of made us all rethink from that point of view, right or wrong. So, but I think they are having those conversations.
Okay. It just seemed like they needed time to prepare in the emails that I was reading, and I'm wondering.
Well, I think it's the distance learning, and also that's what.
No, it was in the context of please don't open, please don't bring the kids back. We need time to prepare.
Yeah, and I will take some of the heat for that, because I believe at the board meeting, what they came away with is if we reopen in person, they will also have to do full distance learning. That's what they're not prepared to do.
Okay.
The other thing the team needs to know is when we discussed options A, B, and C, we're like on E, F, and G, and the executive order is throwing out the fact that we're having to do on-site in addition to all these other things. And you're using the same resources to do all these things, and that's a challenge.
But Dr. Stone, what you said, yes, they would still have to continue doing distance even if they came in person, right? Because not everyone who is in that program, the distance program, will want to come back. So they would have to simultaneously do both.
We will find a way to continue to offer the distance learning. I don't know exactly what that will look like right now, because as we looked at our teachers who said, I would need to stay at home, most of them would probably take over that distance learning piece.
Right. So,
But that's a numbers
so
kind
I
of
guess
game.
the question is, why haven't we already worked on that?
Worked on the numbers.
No,
So
worked
we've
on having both systems be ready for us to get it.
So both systems can be in-person learning. We know how to do that. So as if we open, there are classrooms to be prepared, and teachers know what their curriculum is, and they will offer that. The distance learning is new. Everybody was trying to get on board and get that up and running to the best that they possibly could. And if we switch, we don't have. If you were going to do it simultaneously, you would need to videotape your lessons kind of while you're doing them. We don't have the technology that would do that. So you have to have a group that's over here, videotaping their lessons, getting them prepared to go online, being able to offer those Zoom lessons that are live without having other people's children who are in-person learning in
the
that
video.
environment. So now we know the number of staff who may need to work from home. Now we need to know from parents. But again, we've surveyed parents ad nauseum. So we didn't send out a second survey, not wanting to confuse people with on-site support. And then do you still want to stay in distance learning? So we have the on-site support numbers. We will go ahead and survey families now for if we were to reopen, would you stay in distance learning? And then we would have those numbers, know what grade levels, and know what staff can be a part of that.
And we'll have that all by next Tuesday.
We can email parents pretty quickly. It's a one-question survey for the most part.
Okay.
So we can go from there.
I just want to remind everyone, so since the last board meeting, we've started an online academy that required a lot of work. We effectively trained 250 teachers how to teach in a way they've never taught necessarily before. We've planned content. We have also worked on ordering all of the protective equipment. I mean, all of the things that we've had to do has had a lot of planning, all while waiting for benchmarks, which we didn't know. Was it going to just be a full closure? Was it going to, I mean, with every meeting? And so while I agree, it would be great to say, yes, we have this magic plan of this is what hybrid will look like. This is what it will look like in distance. I would really like to say that. I don't know that what has been given to us has really allowed for that. That has been, we've waited for every chance, and like Aggie said, we weren't quite expecting the on-site. So every chance we have, we've been given, this is what you have to deal with at this time. This is what we have to order to make sure it's ready for our kids. And so those things take time. And we've responded very quickly to make sure the most important thing that we have, which is instruction, is happening.
So would you say that the teachers have been time-wise employed, gainfully employed as much or more than they would in a normal year so far?
So I will say that the teachers have done an incredible job. And like many parents, it has not been perfect for teachers or students alike. As far as teachers thinking about how to teach children and how to really think about what they're doing, it's remarkable. We offered Google Classroom training voluntarily the week before back to week school, and 150 of our teachers came voluntarily. And it was just teachers that we dreamt up, okay, how can we really make sure this happened? And to see the teacher leadership that's going on, teachers working to train parents, just really doing things that I certainly didn't expect they could do. So that has been the shining point of it. And now we really need to think, because what teachers do is great. What does the learning look like? And how does that look like for kids? I get it. Teachers teach. What does it look like for children? And so this Thursday, we'll again be talking about how are we engaging students. So in live learning sessions, what does engagement actually look like? And we're learning. Teachers who are excellent teachers face-to-face are having to learn that. So that is a skill. And I know, again, it's frustration, but as far as staff, that it's been hard work and it's good work, and it will make us better teachers when we teach face-to-face, which is going to happen someday. I mean, that's going to happen, and we will be better teachers for it.
So did we sort of have to reinvent the wheel, or could we not piggyback on other online programs?
So I've been asked this question a lot. Sure, we could have purchased and put everybody on PLP. What is quality about Lake Havasu is our instructors and our curriculum. So for me, although it's a lot of work, don't think that it would be what the board would want, or certainly what our teachers would want, for our kids just to plug into something.
I think what I really meant is modeled on something like PLP, not piggybacked as to just adopt the whole thing.
Yeah, it wasn't about reinventing the wheel. Okay. It's that our teachers have worked really hard to be great in-person teachers. Correct. So they didn't have lots of technology. They didn't know how to put everything in these classrooms and do all the recorded lessons. That's what's taken them all the time to learn.
No, I'm not against anything. Yeah. I'm just trying to understand.
Excellent teachers, just a different mode of how they're providing this to kids. And I will tell you, I walked around all 8 schools, and it was that moment to go in rooms and just visit or say hi. And every teacher was engaged with setting up an area where I have access to my board or I have access to the materials. I want to teach kids and I want to show them on the dot cam how this works, or some involved in meetings, so I got to see kids talking and kind of what they were doing. A few, I might have seen 4 groups of teachers together. And again, they weren't hanging out, just talking about their weekend. They were talking about, what are our assignments for next week? Who's doing what part of this? How are we working together? How have we covered everything? Going into one teacher's room, and she had piles for every day of the week, and it was all the materials that she needed to teach that day's lessons and the materials she was going to use on the dot cam. So they, to your question, they have definitely been gainfully employed, and I won't say that they've done more than they normally do, because I do think teachers as a whole go above and beyond trying to reach out to their families and help their kids as much as possible. But they're definitely engaged in teaching kids.
So that answers the questions of some of the people who didn't want their tax dollars spent unwisely.
I'm sorry, I didn't hear the last part of that.
It answers the questions of some of the people who didn't want their tax dollars spent unwisely.
Well, and I want to clarify, because I know that the learning curve and the effort went into the online distance learning. So when I say you're going to have all that by next Tuesday, that's knowing that the in-classroom part is the easiest part for teachers. That's what they know the best. I wasn't trying to minimize all the training and all that went into getting that part online. I'm saying this is the easier question to answer. So I wasn't trying to insinuate, that you guys haven't had to, jump through 37 different hoops just to get where you are now. But anyways, based on the amount of teachers that emailed that they weren't prepared and that they needed to get prepared, that's what I didn't understand, because it seems like the preparing part is what they must have just went through in order to start online distance learning. The in-person part would be easier because you're already prepared for the online part.
Yes, I'll go back to saying I think their concern is they came away from the last meeting thinking they were going to be required to do both no matter what.
Gotcha. Okay.
Would you mind reading back to me the motion? Or
I can't tell if she's smiling behind her.
I don't think that's a
No,
smile.
I'm grimacing.
Probably
Delay
gonna-
the opening of school until at least August 24th. No, we changed that one. No, in school, in person.
How about I try
School
again?
is suspended until we meet again on August 18th.
Yeah.
And we'll make a decision at that point.
Can we add the word "at least"? I think that's a more precise. In-person school is
before.
suspended until at least August 18th, at which time we will discuss further at our general board meeting.
Well, now you've modified it 3 times. I would suggest that maybe you just withdraw your motion and the second and say we will determine in-person learning on August 18th.
That's why we have a recording, so I can go back and get them right.
So if we do that, do we even need a motion?
Well, she's got a motion on
okay.
that has been modified a few times. I'm just saying a straightforward, we will determine that on the 18th.
But will we determine that on the 18th?
Well, I thought that's what we had all just discussed.
I think we just postponed it till at least the 18th.
And that's why I included the words "at least" in there.
Yeah, and because we may not decide on the 18th, we may say, hey, we're going to wait till the earlier of 8% or September, that, or, something like that.
Well, we probably will. I mean, I'm going to be looking at the metrics. We might not like the PCR, but I'm going to be looking at what happens to make that final decision.
It seems like we should be able to make a decision on when we're going to open by next Tuesday. We were about to make it tonight. So I don't understand why we would say, no, we're not sure we're going to be able to make a decision next Tuesday.
Well, we didn't necessarily have a hard date in place.
I know, but that's what everybody is desperate for. So it seems like we should be able to make a hard date next Tuesday. And if you want to put your metrics in, I mean, it's a 3-1 vote. You guys are going to do what you want to do. But if you say, we are going to open on this date, and these are the metrics that we're going to meet, and we'll open. At least it's something concrete. Parents have to have something concrete. That's if we heard nothing, we heard that tonight. They need to have some certainty.
Yeah, which is why I don't want them to feel like, oh, we're going to give them a date on the 18th, because we probably won't. So, do you see what I'm saying?
May I use this as your motion? We would delay in-person learning till at least August 18th, when the board will discuss and determine an opening date during their regularly scheduled board meeting.
Sounds good.
Can everyone live with that? Well, I mean, we're going to vote on it.
Totally fine. Just so long as parents have a date that they can, I mean, I think a lot of them thought they would have that tonight.
And I would love to just be able to say, you know what, on such and such date, we can open. I do not think that that's a responsible thing to do because our statistics do change. Now, right now, we're seeing improvement, and I hope that continues. But I don't want to be locked into an arbitrary date and then have to change that because the evidence does not support that decision.
I know, but we're using words like evidence and arbitrary while we're actually following arbitrary metrics with no evidence to support them, which is why
I can't go around this tree again.
I know,
can't go around this
but that
tree
is
again.
why it was so important to have
Okay.
that discussion. So you don't get to just make everything up, and I don't mean you, but somebody doesn't just get to make up what's real and what's not. There is science. PCR means something. That's why I gave the inventor and the reason that that test was developed. We need to understand why we're making a decision. And if we can't figure it out by next Tuesday, again, parents should rip their kids out of our school as quick as possible. Because it's outrageous that we would just say, well, we're going to wait until we're down to 8% on the PCR test, which is going to pick up COVID from when you had, or Corona, when you had a cold 10 years ago. We should know what we're talking about. And if we have the health department there next Tuesday, which there's no reason we can't have a representative with a week's notice, we should be able to come up with an agreement so parents have certainty.
Or we could just say we are not opening this term.
Right. Yep.
Okay.
You could do that. You could shut it all down too. Everybody's so paranoid, shut it down, put everything online, reduce our workforce by 50% and call it a day. Because you don't get to have it both ways. That's for sure. Sorry, I want specifics. I've made that clear from the beginning. We still don't have anything that we're looking at. Those metrics are not real metrics. They're not metrics that would be used for any other disease, flu being one of them.
But you ask for specifics, and then once they're provided, you
Those
say
aren't
that those are
specific. I know, I asked for
propaganda.
science.
Yes, and then you're going to disagree on how they derive the science, which
It's not me disagreeing.
Reasonable-
Please understand, it's not me. I'm not like looking at it and going, I just don't like it. I'm a conservative, so I just don't like it, and I want to open up the school and kill all the kids. That's not what it is.
and I never said anything.
I know, but that's
remotely
the
close to that.
insinuation, people who
No,
are
I do not believe
cold-hearted.
that.
Not from you,
I
but
make the
in
assumption
general.
about every person that I meet that they do not want to get sick and they do not want to get everyone else sick.
I
Unless you
understand
tell
that,
me
but
differently,
those
that's my
people are
assumption.
still going to the establishments. That's what I'm saying. Our teachers are going to the grocery store. We've got, people in the medical profession that are seeing sick people that come in every single day. They've all got families. They've all got kids. The rules don't apply to anybody or the rules apply to everybody else except the staff at Lake Havasu Unified. And that doesn't mean that the fear is not legitimate. I get that, which is why it's important that we know what we're looking at. And what we're looking at is not important based on many epidemiologists, many infectious disease doctors, many people who will take the time to sit down and explain the science, that will share their studies, their peer-reviewed studies. I haven't seen our health department do that at all. I haven't seen our state do that. I haven't seen our federal government do that. And the physicians that are working on the front lines that have done that are being silenced by Google, Facebook, Twitter, and YouTube, and are being fired from their jobs. So we have a big problem here.
The only thing we need are randomized controlled studies, not peer reviews. They are not acceptable, but let's adjourn for now.
I think that's a good idea.
I
We can
need-
call the question.
I'd like to make a final comment.
Okay.
Nicole, I've been in several doctor's offices for everything from allergy to my 6-month appointment. I mean, I've been, and every time it's very controlled. I go in, they do my temperature, they ask me questions, there's physical distancing in there. Somebody comes and gets too close to me, I back up, or I actually walk outside. I can go to the grocery store, I watch, somebody gets too close to me, I back up, I go down another aisle. I have control. The only people who don't are people in the emergency room. But there is a lot of control. Once you get into school with all those kids in the hallway, it'll be like the emergency room. There is a lot more control. I just wanted to correct that because it makes, those comments about teachers, they just look bad.
I'm not trying to make teachers look bad. I'm just trying to.
No, you're not the one. Others have said it. Some of the letters I got, that, I'm an essential worker, and you are too, and I'm a nurse, da-da-da-da. I just want to clarify, I've thought about that a lot, and there is a distinction between a nurse in an office, a doctor's office, and it's true in emergency rooms in the hospitals that their lives really are in danger. They really don't have any control in an emergency. But in doctor's offices, they do, everybody does. And so I don't want to throw our teachers and staff in a position like the emergency room in a hospital where they're just crowded with people coming and going and whatever. We have to have some controls. Anyway, I'm done. I just had to say
Okay.
that.
I'd like to call the question.
Yes.
Nicole Cohen?
I'm sorry, I'm trying to think of what the motion was. Wait until next Tuesday? Yes.
Kathy Cox?
Yes.
Tatiana Allier?
Yes.
Lisa Roman?
Yes. Do we have any further announcements? No. Okay, then do I have a motion to adjourn?
Second.
Kathy Cox? Yes. Nicole Cohen?
Yes.
Tatiana Allier?
Yes.
Lisa Roman?
Yes.
Thank you.